Thank you. Good evening, everyone. Welcome to the regularly scheduled Mayor and Council meeting for the Town of Berlin for Monday, March 14th, 2022. We'll begin with a moment of silence, followed by the Pledge of Allegiance. Thank you. I pledge allegiance
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. We'll begin with agenda item number 1, which is the approval of the minutes for the open session for February 28th, 2022.
Motion to approve.
I have a motion by Councilmember Merritt.
Second.
I have a second by Councilmember Nichols. All in favor, say aye. All opposed? Let the record reflect that the open session minutes from February 28th, 2022 passed unanimously with Councilmember Purnell absent. Up next is the approval of the regular session minutes for February 28th, 2022. Hold on one second. We have the open session and the regular, because we have two back to back.
Right.
Wow, okay. So I need a motion to approve.
Watching there's a correction for the regular session minutes. I've already talked to Kelsey about it, but under first readings B, I'm sorry, number 5, first readings, letter B, about halfway through the paragraph, Councilmember Nur reads, then asked if owner occupied could be removed, and it's actually, I talked to Councilmember Nur. Councilmember Nur then asked why the owner occupied section was removed.
Okay.
And
You have the correction, Kelsey?
Yes.
and then with that, I'll make a motion to approve.
So I have a motion by Councilmember Orris to approve the regular session minutes from February 28th, 2022 with the amendment.
Second.
Second from Councilmember Nur. All in favor say aye. All opposed? Let the record reflect that the regular session minutes for February 28th, 2022 passed unanimously. All right, agenda item number 2 is a proclamation for World Down Syndrome Day, which is on March 21st, 2022. The Peters family is here with us, along with some other local families as well. I do want to thank Miss Rebecca Peters for reaching out to see what we could do to help raise awareness for Down syndrome in our community. I understand that, and we'll let Ms. Peters speak on this in just a moment, that previously, before they moved to Berlin, there were resource groups available for families to come together and share their thoughts and their feelings and help work together. I'll come right down with you in just a moment. And with that being said, the proclamation and the awareness that we're going to do in the town of Berlin for March is designed to help raise awareness of Down syndrome and those within our community to help bring people together. So I'll be down in just a moment. Now, do I have to call you Mr. Ambassador? Good to see you. And Tommy, you're going to help me with this proclamation, aren't you? Why don't we come right over here so that everybody watching at home can see us too? All right. So, Rebecca, do you want to just elaborate a little bit on the resource groups from where you used to live to being here in Berlin?
Yes. I am working with the Down Syndrome Association of Maryland, which is based in Baltimore, and we previously lived in Bowie, Maryland. We've been here for about a year, and I'm helping expand their services out here on the Eastern Shore. We're hoping to plan an awareness walk, maybe in Assateague or on the boardwalk. We're planning medical outreach programs to help doctors provide positive diagnoses. What else are we doing?
I think just working with
Trying to just raise awareness, get everyone in the community educated, informed, and involved. We have big dreams for these little guys, and everybody's support is pivotal. So thank you for inviting us, and we're very excited to be here.
Thank you. We have big dreams for all of you as well. All right, so let me read this for a moment, just for everybody watching at home, okay? And Tommy, you're going to help me with this, right? Because I told you, I get nervous and I feel better when people are here with me, right? All right, so this is a proclamation of the Mayor and Council of the Town of Berlin declaring March 21st World Down Syndrome Day. Whereas approximately 700 children are born with Down syndrome, representing about 6,000 births per year in the United States. And whereas 400,000 individuals living with Down syndrome in the United States possess a wide range of abilities and are active participants in our local community, just like you, Tommy. The colors yellow and blue are used to raise awareness, as you can see right here. And we're going to light up the trees downtown in Berlin with yellow and blue. And we're going to do that on the 20th, the 21st, and the 22nd. So you have to go by there and take a look. So I didn't know this, but you can also wear mismatched socks on the 21st. So I like my different socks. I've got fish on there today. So I think I'm going to mix match my socks on the 21st. Are you going to do that too? Yeah. Okay, good job. All right, so yes, good job. Let's see if we can all get a picture together. Tommy, can you come up here and help me? Connor?
Mr. Mayor,
Yes.
what is T1 squad?
I don't know. T21
Oh,
squad.
T21.
So the 21st
Yeah,
chromosome,
I'm
right?
half, I'm
Yeah.
half.
It's trisomy 21, which is also, Down syndrome.
It's okay.
Does everyone want to say cheese? Can you look over here and say cheese? Ready? 1, 2, 3. Cheese. Great job. Thank you.
Good job.
Thank you so much.
Thank you. Now this one's for you. Thank
Thank you so much.
you. High five. Good job. Mr. Ambassador? Tommy, you're going to be the next mayor, right? All right, good job.
Thank you very much.
Thank you so much. Thank you, everyone.
Thank you again.
Thank you so much. Thank you.
Nice to meet you. Thank you. So up next is agenda item number 3, which is the swearing in of Jonathan Hill for the Housing Board of Review. Jonathan, thank you again for agreeing to serve.
No problem, thank you,
We
sir.
appreciate it. Come right over here if you don't mind, and we're going to raise your right hand and repeat after me. I, Jonathan Hill,
I, Jonathan Hill,
do swear and affirm
do swear and affirm
that I will support the Constitution
that I will support the Constitution
of the United States
of the United States,
and that I will be faithful
and that I will be faithful
and bear true allegiance
and bear true allegiance
to the state of Maryland
to the state of Maryland,
and support the Constitution
and support the Constitution
and laws thereof,
and laws thereof,
and that I will,
and that I will,
to the best of my skill and
to
judgment,
the best of my skill and judgment,
diligently and faithfully,
diligently and faithfully,
without partiality or prejudice,
without partiality or prejudice,
execute the office of
execute the office of
the Town of Berlin
the Town of Berlin
Housing Board of Review,
Housing Board of Review,
according to the Constitution and laws of this state.
according to the Constitution and laws of the state.
Thank you. Congratulations. And then Kelsey's got something right here for us. And then that makes it official. Go ahead. Yep. Thank you again. I'm glad you're doing it. Yeah, me too. Congratulations again. Thank you. Thank you, Kelsey. All right, up next is agenda item number 4, which is the Burbage Park table tennis courts. And we have representatives from Weehart Berlin. It says Tony Weed on the agenda, but we have Jeff Smith.
Sorry, I wasn't able to grow my beard long enough in time.
We'll give you a head
Do my
start.
good Tony Weed impersonation.
And then we also have Mike Wiley, who's the chairman of the Parks Commission. Thank you for joining us.
Thank you for having us.
So do you
well-
want to kick it off with just highlighting the project, and then we can get into any questions from the council?
Yes, so the project is to build a table tennis park at Burbage Park, which is the park located on William Street, next to the town power plant. The We Are Berlin has already got the tables, and we've already given them to the town, so we're just waiting for the town's approval. I think it's gonna be a great addition to a park that really isn't very used. There's already been a lot of excitement about it, so we're really excited to get the project underway. And
We're
we thank
excited.
all of you for your support in getting this taken care of.
Thank you. We're excited for it too. The drawings look great. I can't wait to go out there and play. But any questions from the council to Mr. Jeff Smith? We also have the MOU in the packet as agenda item number 4, if anybody has any questions about that as well.
Jeff, I had one question. I know that a lot of people were concerned about the site and the loss of possible green space. From what I see in the picture, it looks like the only area that won't be green, correct me if I'm wrong, is just the area directly around the tables. Is that
It's actually just the tables themselves. Everything else will still be grass.
okay?
And in fact, we decided, our original plan was to put the parking spaces to the right side of the driveway, if you will. And then we moved them in part because there's a sign there, and in part because we thought that would help add more green space for
Great.
the area, to keep the area more open.
Thank you.
Thank you. And then we have Mike Wiley here also, so if you have anything from the Parks Commission.
I haven't received too many comments from people using, people stop down the street or whatever. One of the concerns was the, this will be brick all in here, right?
It's all gonna be brick,
Yeah,
yes. that is
yeah.
correct,
I had concerns just about through time, the bricks becoming uneven, frost heaves and things like that. We've had enough problem with frost heaves and the walking path. So I guess we're a little gun shy on that, except for that reason. But, other than that, positive comments, people are glad to see it's at least being used. Years ago, we did a survey in the electric bill, I believe it was, and had people come forward, and people said they didn't even know it was a park there. I had a guy argue with me. It was before the days of Herod Park. And he said, you only have 2 parks? I said, no, 3. And he swore me up and down. He started getting angry about it. So at least now he'll be able to see.
Mike, it's my understanding that the bricks aren't set in mortar, they're set in sand.
Sand.
If it needs a repair, it's
Easily done, yes. One of the concerns was that they become unlevel as far as people, when they're playing, they're tripping and things. That was, someone voiced that. Those about the only things I heard. Other than the fact people were glad to see it being utilized.
Mike, have you seen the tables down in City Dock in Annapolis?
No, I haven't.
So down Mike's former Anne Arundel Fire Department. So down there at the City Dock, they also have them, and it's all brick there as well.
Right, yeah, because as a matter of fact, we're doing it now, I think, yeah.
That's very cool.
Yeah.
We are also, oh, sorry.
I was gonna say, I'm used to walking on bricks.
I would say so.
Yeah.
I just wanted to point out that we are also selling names on bricks for anyone interested in donating to help support the park and to support We Are Berlin.
Well, that was gonna be part of my question. These are bricks are gonna go for the wall and these walkways around the tables?
Yes.
Okay. And then, Mr. Charles, do you have any, I know you've been working with the Parks Commission and We Heart Berlin, do you have any specific concerns or anything?
We talked about the concerns before with Tony, and everything seemed to be addressed, and I have no concerns at this point.
It actually tied in, I think there was a good portion of staff that were on the meeting with We Heart Berlin. We brought everybody in with the potential concerns and tried to make sure that we addressed those from the early part before they ever started drawing. So I think it worked out pretty well.
Jeff, with the bricks, how would, if someone were interested, what would they need to do and how could they be a part of that process?
Just go to weheartberlin.org and click on the donate button. There's a link there for buy a brick at the tables at Village Park.
Is there a time frame?
No time frame at all. We have the ability to put bricks in after the park is built.
Great.
Very cool.
If there are no further questions or comments from the council, I would like to move to approve that we proceed with Burbidge Park and the table.
We're calling them the tables at Burbidge Park.
And does your motion include the approval of the MOU?
Yes, absolutely.
So we have a motion by Councilmember Burrell to move forward with the tables at, the tables at Burbidge Park. I'll have to get used to that one. And the MOU. So I need a second.
I'll second that.
And I have a second by Councilmember Nur. All in favor say aye.
Aye.
All opposed? Let the record reflect the vote was unanimous. Thank you. Congratulations.
Thank you very much. Thank you all for your support. We are relieved.
Thank you. Thank you, Mike. So up next is agenda item number 5, which is draft RFP discussion for the William Street Lift Station. And we have our Water Resources Director, Jamie Latcham, and we also have Josh here to assist.
Yes, Mayor, we're seeking approval for the draft RFP so we can go out and bid. The reason it's being is the equipment in the lift station is roughly, I think I found an invoice for December the 18th of 1970. So, you know, since AGH is here, every now and then people do need upgrades, like a new knee and stuff, so we're pretty much putting a new knee or something into it. So.
I like that tie, I like that.
But we need to get moving because we've had a machinist there to look at some stuff, and one of the pumps are there's not much more metal left to be able to hold it down onto the pump base. The unique system about William Street is the pumps are in a dry well, so we were going to replace it in kind as it is there now. Once Josh and I got talking, we decided that we thought it would be more feasible to put the lift station at grade. One would reduce the confined space entry and a fall hazard because it is roughly about 14 feet down in the ground. So once we started looking at that, and there's just a little bit more money, but you know, our life, I think, is worth the little bit more cost effective of putting it at grade.
Thank you. So we talked a little bit about the type of lift station you want to put in, how many of these we have that are roughly in this similar condition out of the lift stations that we have available, and then the potential cost of something like this. So if we could just hit on those items, I think it would be nice for everybody.
Certainly.
Thank you.
Good evening, Mayor and council persons. Thanks for having me here tonight. Any questions you guys have tonight or any other time, always feel free to reach out to me or Jamie and he can get a hold of me. The town has over a dozen pump stations, but we've been focused on, in particular, 2 of them just over the last couple of years. This one, the William Street Pump Station, which Jamie brought to my attention, that half the bolts holding the pump, the suction pipe were gone. It could not be repaired in place, and if there ever was a failure of that joint, the entire pump station would be underwater. Unfortunately, the controls are also down, located in this bomb shelter type lift station. And after looking at it, we knew what we thought could be a pump replacement was the valves. It was going to turn into an overhaul. He said a knee replacement. I call it a knee and 2 hips, but it's definitely needs an upgrade. Bringing it up to grade is going to make everything safer. Get rid of the confined space entry, the issues that you have with sewer gases and hazards there. And it's just going to make it, instead of buying us 5 or 10 years with a Band-Aid, if we could put $250,000, $300,000 into the station, we can get another 40 years out of it. One unique thing about the William Street Pump Station is that the existing wet well is located in the SHA sidewalk. So we are going to do some investigation, rehabilitation of that, line it with a structural sealant that will give it several decades, not get into the SHA roadway and avoid that additional excavation, which will save quite a bit of money. But this, we kind of look at this as a pump station upgrade at a replacement at an upgrade price. So definitely looking to save some money. The other pump station I mentioned is the Broad Street Pump Station. And if you think 50 years is old, Broad Street was built in the 30s, overhauled in the 50s. And it's, if Jane was here, I'd ask her to tell some stories, but it doesn't know you a dime. We certainly don't want to try to rehabilitate that. We're going to come in on that piece of property and we'd like to put a brand new pump station, state-of-the-art controls, SCADA, monitoring, and like to do that as soon as possible, but we believe William Street is the higher priority just because of the probability of failure there and the consequences of failure.
And the questions come up, I've had multiple questions regarding William Street, 250 to 300,000, Broad Street, $1 million. And the simple explanation for that is, as Josh mentioned, the William Street is more of a refurbished, the wet well's there, Broad Street, it's everything. It's a complete new. So that's why there's such a huge difference in price. And then what I also want to share with council, this William Street project came on all of a sudden. The good news is, out of all this, in FY 22's budget, Jamie projected as far as revenue from septic hauling about 100,000. To date, we're a little over 500,000. So the next question is, why is it 500,000? We're actually taking septage now from the Walmart, Home Depot, for an interim period of time, and that's pushed all this way up as far as revenue.
Yeah, we won't be able to bank on that revenue
That's
source
correct.
indefinitely,
No.
but
we're, they were in a jam, and, that's what we strive to succeed, and we help them out, and that's where we're getting our extra income revenue right now.
the important takeaway though is the number of these that we have that have reached their lifespan of 40 years. And you said what, there were 12 to 13 of these in the town. And you identified roughly 5 of them that are at or near replacement cycles. So if we're looking at that at $250,000 to $300,000, it doesn't take long for us to reach a nice pretty number there. With that being said, we've discussed fees here before and a capital fee that could be used for things like this. So we have the money today for this one, but if we're here tomorrow with something with Broad Street, we're not planning for those types of things. So we need to strongly consider that.
And we have a couple lift stations that a lot of residents don't even know they're lift stations because they're actually in the middle of the road and people ride across them and don't think nothing about them. There's one on Flower Street and there's one on West Street. First off, when we do both of them lift stations, we have to get the electric department from Tim with the pole truck to pull the lids because we don't have nothing heavy enough. We have to have flaggers, and it's just a big pit in the middle of the road. Really, I mean, it's all concrete, but that's a heavy steel lid, but it could fail in time too. And really, truly, it's not cost effective because we have to get Tim, then we have to get flaggers. I'm hoping in the next few years we can look at putting, at least moving one out of the road, and trying to do it strategically to get it out of the road and be cost effective on moving it.
Thank you. So this evening, what we're asking is to approve the draft RFP for the pump station for William Street with using the hauler fees that we have. Do we want to cap that at 300, or do we not feel comfortable with capping it?
I'm going to speak for this. I feel the 350 would be comfortable, but with the pricing of today's society right now, I think let us at least get our bids in, and then we could bring you up to speed with that. I'm not asking for approval for everything, but I just with today's society, I mean, we're getting hit with 10 to 25 to even some of our stuff has gone up 50%. I just don't want to be right there and then we have to wait. That's your decision, but I would at least like to see what the bids come in, and then we can't approve nothing until you all approve it. So.
And we're gonna set up the bid with separate items, so that if there's, I've seen prices come in right where we think they're gonna be, I've seen prices come in 2 times where we think they're gonna be. But if we're gonna set up the bid, so that if it doesn't come in over budget, we can weigh different options on eliminating items or handling certain items separately. But I would say, I'm the engineer, I'm gonna say don't cap it, but
It's okay. We'll wait and see where the numbers.
So this is a draft. I mean, if we go ahead and approve this, do we need to approve the final as well, or can we just say this is the RFP?
We'll come back to you for the money.
You will.
We'll come back with the money, yes.
But I think Councilmember Orris's question,
Like are we gonna have to approve another document, or can we just go ahead and do that?
you could approve RFP 2022-02
Okay.
as you see here, and what we'll do is we'll strike the word draft and publish it.
So if there's no questions from the council or department heads, I'll make a motion to approve RFP 2022-02 to its final form.
Thank you. I have a motion by Councilmember Orris to approve RFP 2022-02. Second by Councilmember Burrell. All in favor say aye.
Aye.
All opposed? Let the record reflect that RFP 2022-02 passed unanimously. Thank you.
next time where it's at, gotcha.
Seems like you can get it done in a polo, so why if I change it, right?
I'm on the run tonight. So.
Thank you,
Thank you
I
guys very
appreciate it. All right, up next is agenda item number 6, which is Atlanta General Hospital's annual presentation, and we have Dr. Dowling here with us, and I believe I saw. Oh, okay. How are you, sir?
How are you guys?
Chairman of the board. I thought so. And then go ahead and introduce your team if you don't mind.
I will. Thanks for having us tonight, Mayor and the council. Go across the dais pretty quickly. You have AGH family members up there too. Councilman Burrell is an employee of AGH. Jay Gurr, Councilman Gurr, is a board member of AGH, a finance committee member as well. So you got some local up there. And then Sarah Hamberry's here. She represents on our foundation. And also Tony Kaiser, who's public relations executive. And we have Andy West McCabe, emergency department. Dr. Sally Dowling, who's wearing a couple different hats right now. Most importantly, the co-interim CEO, and Shelley Geis. And so they're going to talk to you a little bit. The thing I'll talk to you about tonight to get started with is the state of the hospital. It's a very exciting time. Tomorrow we start interviewing new CEOs. So we have 3 CEOs coming in over the next 2 weeks. We're excited for the process. We've got 3 excellent candidates coming in. In the past 5 months, the hospital's been through a lot, starting with the non-renewal of the CEO's contract. We're very fortunate, and it was probably, I don't know how we made the decision, but it was a tremendous decision. We named Dr. Dowling and Kim Justice as the co-CEOs and interim CEOs. They want to get rid of that title, I can tell you. They're anxiously awaiting the new CEO, but they've done a tremendous job, and it couldn't have worked out better. And one of the reasons that we had faith in the action that we took was of the senior leadership team at the hospital. They're a very mature group, and they just do a wonderful job. And in this period of time, they stepped in. Not only were they without a CEO, you had a Omicron spike. There was a Kronos problem, which was a problem with our payroll system. Our payroll failed about 2 weeks before Christmas. So, and then in between, I think the TVs went out one day in that process when the hospital was full. And then we did Joint Commission about 2 weeks ago, and the exam went very well. So, hospital's been very busy. You should be very proud of them. It's one of the things I've learned over time. It's our rural hospital. It's a small hospital. The people there take care of their friends, their family, and their neighbors, and they do a tremendous job of it. And they're very proud of the work they do. So, Dr. Dowling will share some thoughts with you, and then Andy and Shelley as well, and that will be your update, and I'll wrap it up in a few minutes.
Thank you. We appreciate it. Thank you all for coming.
Thank
you for your leadership and also Ms. Justice leadership during this time. So.
Thank you very much. And I want to say on behalf of all the associates at Atlantic General, it's truly an honor to care for the citizens of the town of Berlin, and we thank you all for your continued support, and we're very committed to always providing the best health care possible. So thank you, Greg. I wanted to give you an update of some of our initiatives. We have had a busy, crazy year, but we've managed to have some exciting initiatives that we've been able to implement. One of the most exciting is the opening of the Atlantic General Behavioral Health Crisis Center, which we opened on our campus on January 31st. It operates as a walk-in center for mental health and substance abuse people in crisis. It is currently operating Monday through Friday, 8 to 3, almost works per se like an urgent care, no appointment necessary. Patients can come in, they can be evaluated, they can be seen by a psychiatrist and other mental health care professionals. They can receive prescription medication. If needed, they can be facilitated to get them to a higher level of care. And most importantly, they can be lined up for subsequent services. It's been a big need in our community. I'm a family physician, and I can't count how many times I've seen someone in the office who, not sick enough to be in the hospital for, suicidal thoughts, but need help now, not in 8 weeks when the next available appointment is. So this has really been an exciting project. We have found since we opened that almost 40% of the patients have been pediatric. We do see patients from age 5 up. So it's definitely filling a need in the community, and we're very excited to be able to provide that need. It was developed through a partnership, which is called the Tri-County Behavioral Health Engagement. Tidal Health is involved, some other health agencies. So it's really a true team effort to provide the service that the community needs. Another exciting thing that we have kind of completed is what is called Mobile Patient Experience, which is an app on people's phone where they can now schedule appointments, they can register before their appointment, pay co-pays, change their insurance, and they can also, as soon as they're completed from an encounter, they get a summary of their care with their instructions right on their phone. So it's very exciting. People really love it. I think it'll be a great tool for our community. We've made several purchases from general funds. We got a new bone densitometry machine, 4 new ultrasounds, and an echocardiogram machine. We were able to integrate telemetry monitoring directly into our health record. And we have purchased a new automated sterile instrument management system. Doesn't sound very exciting, but it's great, and of course all about patient safety. Over the past year, we've added 9 new providers to the area, which we're very excited about. 3 family medicine providers, a gynecologist, another orthopedic surgeon, a neurologist, an anesthesiologist, and 2 endocrine providers. So that is great news. The other very exciting project that we're just about to start is something called Ambient Technology. DAX is the program we're going to be using. And it's technology that's used in the outpatient office where there's a device in the room that basically acts as a virtual scribe. So when the provider comes in, they can look right into the patient's eyes and have the whole conversation with the patient. They're not trying to type on a computer screen or click on different things. And the technology takes all the information and transcribes it, and then when the provider leaves the room, the encounter comes to them on their computer and they can sign it off. So, we think it'll be great for the patients. We're all dying to see people more eye to eye. Great for the providers where they're going back to what they love about medicine. Should also help with efficiency, which also increases access for our patients. So we're really excited about that. We're piloting 5 providers. I believe it's going to start now at the end of April. So we're really looking forward to that new technology. As Greg mentioned, we went through our JCAHO survey, which if you know anything about healthcare and hospitals, that's a big thing. And we had the surveyors come through. They were extremely complimentary and told us that although they don't give you a score and a number, if they did, we would have scored 99%. So we're very proud of that. Now, not to say that this year hasn't been without pressures. You guys know a lot of them. COVID was overwhelming at times, but hopefully we're on the other side of the big surge. Physician recruitment continues to be a challenge, even though we have done well and recruited those 9 providers. It is difficult to get providers to a medically underserved area. I'm sure you've heard and read about the national nursing shortage. That hit every area hard, including our hospital. The high cost of travel nursing really exponentially increased this year, which was difficult for us to manage. During the last Omicron surge, we had not only the highest census the hospital has ever had for a sustained period of time, but we're also dealing with a lot of the staff either contracting COVID or having to be quarantined because of exposure, which really led to some challenges. Because of that, actually, that was the reason that we shut down elective surgeries for the second time during the pandemic. Initially when we did it, it was more of concern of cross-infectivity, This time, we knew that that was fine, but we needed the staff from the OR to help us on the floor and in the ER. So we did shut down elective surgeries for the second time, which, you know, is hard on the patients, hard on our finances, honestly, but it was the right thing to do for the community. And just a word about our community connections. I mentioned that the Behavioral Health Center is through a partnership with some community organizations, the Health Department and Title Health. We have a partnership with Chesapeake Housing Mission, which you may be familiar with, that works also with the Health Department selecting individuals who are at risk because of their living environment. HEH has worked with them to build wheelchair ramps for several of these community members, several of which were in Berlin. The hope being that if we can keep their home environment safe, they can stay home longer, but also be safe there, not have an increased risk of falls, which can certainly be a detriment to their health. We work very closely, as I'm sure you're aware, with the Health Department. We also work with Project Search, which works with the Worcester County Schools, having some of the special ed students in doing internships in the hospital. That's been very rewarding for us, and we are proud to be a part of that. So I've talked enough. I'm going to pass it off to Andy West McCabe, Director of our ER, to share some of her experiences.
Thank you. So as everyone's mentioned, this past year has been quite a challenge. Summer, everyone was wanting to come to Ocean City, come to Berlin, get kind of a sense of normalcy, and things seemed to be going okay, and then the fall hit. We had the Omicron surge. At that point in time, we had to have no visitors at the hospital. It was extremely hard for patients and family members to not be able to visit their loved one and to be able to drop them off at the door and have to trust that we were taking care of them. About that same time, the holidays started coming, and everyone wanted to go home to see their family for Thanksgiving and for Christmas and those things, but the surge was still very strong then. At that point in time, on our inpatient basis, we had every bed filled, and we were having to staff utilizing agency upstairs for the inpatient side, but it overflowed into the emergency department. About that time, we started holding patients almost every single day. At least 4 or 5 days a week, and that went on from June until January. Very hard, because at one point in time we had all 19 of our emergency department beds filled with inpatients, and we still had patients coming, needing to be taken care of. So it was constantly a stretch as to who can we put in the hallway, can we get upstairs quickly. So it was quite a challenge. At that point in time, we also had shortages. We already talked about the nursing shortage, but there were medication shortages at times. And there also were supply shortages. So trying to work with other companies than our normal companies to get supplies so that we were always able to take care of our patients and do everything we needed. And then of course, along with this, our clientele that we were seeing in the emergency department completely changed. We started seeing a lot of patients with addictions, specifically with alcohol, a lot of mental health and abuse and neglect cases, and sexual assaults. With all of this, as hard as that was, the hardest part of it was the misinformation of people. I know every one of you have dealt with people that are feeling very strong about, do get vaccinated, don't get vaccinated, it works, it doesn't work, do wear the mask, don't wear the mask. A lot of misinformation about what treatment worked, so trying to work with people, we saw the best of people and the worst of people at times, and just trying to plug through and do everything we could to take care of those people while they were waiting. And we have an emergency department that we don't like people to wait, so it was hard on all of us, because we wanted to give that great care that we always gave. Through all this, we saw a lot of wonderful things, a lot of accomplishments. We were able to make rapid changes. When all these family members were all coming wanting to be swabbed, we had 10 and 12 family members at a time coming. And literally, I can't tell you, one day we swabbed over 100 people just in the emergency department alone. I worked with our Plan Ops team, and I said, what can we do? And we set up a tent swabbing area in our waiting room so that we could put whole families in there so that everyone could still be socially distanced and being taken care of. The OR were tremendous. When we had nowhere we could see ER patients, the OR stepped up. We shut down the elective cases. We continued to do emergent cases. And that team would every morning take over as many of our staff, many of our patients as they could, so we could continue to see emergency department patients. It was a godsend. Without them, we were just gridlocked. So when they were able to do that, it just helped everybody along the way. Communication was excellent. Every day we met with our normal 8:15 huddle, but we met twice a day with Code Hope, which is help our patients in the emergency department. We would meet twice a day to say, what can we do differently? Can we bring in more staff? What went well yesterday? What do we need to work on today? So we're constantly improving and changing and making those changes. And in the end, I have to say the excellent teamwork across the hospital, the doctors, the nurses, everyone was doing everything they could. Our ER docs, when we were at our peak surgeon, they weren't as busy because we were literally holding patients in those beds. They were pushing patients to x-ray, they were taking out IVs, they were doing whatever they could to help. And that's what it took. It took partnership across the whole hospital. Through all of this, I'm really proud to say our forensic nurses in the emergency department received the Shiro Award in Ocean City this year. We also, the ER was nominated and we received the award for October, November, and December this past quarter for dedication to excellence for all that we have done to get through the whole Omicron surge. And we also found out that we won the Top 100 Rural Hospital Awards for the second time this year. And all through this, we continue to serve our community and give our excellent care. So thank you for trusting us with your loved ones, and we will continue to do that every day.
Thank you. I think that it's an awesome thing to accent those accomplishments through something so difficult as the pandemic and the challenges that Greg shared with us.
Thank you.
So thank you for that.
Thank you. Shelley?
Hi, my name is Shelley Geis. I'm the Director of Nursing for the health system. So that consists of 20 offices within the community as well as Pocomoke and as far as Ocean View.
I'm sorry, Shelley, can you move the microphone over
Oh, I'm sorry.
closer to you? Just so everybody can hear you.
Is that better?
Well, I'm okay, but I just.
Okay. The beginning of COVID, Townsend Medical Center was turned into a COVID clinic. To date, we have COVID swabbed a little over 6,800 patients. The patient volume, as an example, in 2019, we saw a little over 3,500 patients. In 2020, a little under 5,500. In 2021, a little over 10,000 patients. Our volume doubled. As of 10/21, we have performed 281 flu swabs. 43 of those were positive. Over the past couple of years, we have watched our providers and staff step up to the many challenges COVID brought, and I can't begin to express how proud I am of everybody. When COVID started, offices were closed, and staff was redeployed to the COVID clinic as well to the hospital. And as we learned more, we started opening offices and learning to adapt and overcome the many obstacles that COVID brought. This last variant was extremely hard. As Dr. Dowling had stated, we had staffing challenges and a significant number of employees out with COVID. At times, I would look at my leadership team and wonder how we were going to meet the needs of the community within the offices, but somehow we did it. And with that being said, we were also able to open Townsend Urgent Care 7 days a week early January to support the large volume in testing and sick patients. And also trying to help divert from the ER the patients that we could see that were not necessarily ER appropriate. As a strong, united team, the health system persevered, and as I stated earlier, I couldn't be more proud. Thank you for allowing me to share with you how awesome our providers and our associates are, and thank you for your continued support to our hospital.
Thank you.
I forgot to mention that Mayor Tyndall participated early on with us with when we went to several groups within the community to talk about what the new CEO would look like. Mayor Tyndall was there for us. I don't know if you're going to join us for anything this week.
Thank you. I really wanted to join everybody for this week and next week's luncheons, but unfortunately I wasn't able to do that. So I did reach out to Charlotte and let her know.
All right, great. Well, we appreciate you coming in the beginning. So I'll wrap it up. I mean, you heard three people that are on the front lines in the hospital, and they all had, it was a challenging time in the hospital working, but there's a lot of great stories that came out of it. And those stories are based because they worked as a team and they're just a wonderful group of caring people. So, I mean, as I mentioned earlier, we're a small rural hospital. We enjoy our independence and we hope to continue that. So, with that said, we'd like to thank you for your past support, and we would hope that you would continue to support us in the future.
Thank
If
you.
you have any questions, these guys, feel free.
Well, one thing I do want to say is I've sat through probably not nearly as many presentations as my colleague, Mr. Burrell, but I would like to say that this is very thorough. I like the different perspectives. It's very nice to hear. Nothing against Mr. Franklin, but this was a very nice presentation, so thank you.
Thank you.
And then we'll take any questions.
Greg or Sally, can you talk briefly about the new ambulatory surgery center and what that means for the community?
I can say that we have been working on it for 3 years. It's on 589 Ocean Pines, and they have begun moving dirt. So it'll probably be, let's say, 18-month to 24-month project. When done, there'll be 4 suites in there. There will be office space in there, and the rest of the mix is being looked at and decided what we're going to put out there. But it will be as the medical world changes and the insurance world changes, more and more procedures are being pushed out and not paid for in the hospital, and that's one of the reasons we've had to go to an ambulatory surgery center. And it just provides another service and another means to serve the people of the community. We have that. Sally?
Sure, and ambulatory surgery centers have several benefits for patients. Number one, they can be much more efficient and provide more access to patients since they're not part of the hospital structure. They're known for being efficient and really getting people in and out carefully, safely. Also, you know, overall, we have a very low infection rate at our hospital, but when you look at hospitals overall, infection rates in ambulatory surgery centers separate from a hospital are always lower than an OR in a hospital. So it'll be convenient for the patients, it'll be efficient, lower infection rate, better insurance coverage. We are running into some insurers who don't want to pay for any procedures in our hospital, and there is no ambulatory surgery center in Worcester County right now. This will be the first one, so it's necessary for the patients as well. And we're analyzing which specialists make sense to have their office space there. So that will be part of it. We're going to have another Ready Scripts pharmacy. So it's very exciting to finally see the dirt being moved.
So currently, the existing hospital has limited ORs. This really expands upon that.
Correct, yep. And our ORs, to be perfectly honest, need a major renovation, but you know, when they're busy all the time, you can't renovate them. So once we have the ambulatory surgery center open, then we'll work on our plan for renovating our current operating rooms at the hospital itself.
One last question. Could you talk briefly about the AGH Foundation and the people involved and all the great work they do? That's the fundraising arm of the hospital.
That is the fundraising arm of the hospital, and Tony would probably be the best to speak with that, or Sarah.
Sure, I can speak to it. We have a wonderful foundation. We have over 77 members that serve on our foundation currently. They serve in all different capacities, from helping with grant writing, special events, major gifts, planned giving. It's a tremendous group of individuals. We are a not-for-profit organization, so the only way that we can continue to expand services, recruit physicians, build infrastructure is through fundraising. And these individuals just are. I've been with Sarah since 9 o'clock this morning working on a project coming up this spring. So they are so generous with not only their donations, but with their time.
Thank you. Thanks. Any other questions?
I don't have a question, just a comment. I think it's great, and I'm continually impressed when I am around different agencies and whatnot, that the partnerships that different folks have in Worcester County. AG, you mentioned public schools and other agencies, and I just think that that's so important, and I don't want to say overlooked by the community, but it's just something that folks might not think about. So I think that's great, and thank you, a great presentation.
Thank you. Thank you all very much. I appreciate your time and your support.
Thank you. Thank all of your staff for us as well.
We will. Thank you.
Thank you.
Thank you.
All right, up next is agenda item number 7, which is going to be a public hearing on ordinance 2022-01, establishing a crematorium as a conditional use in the M1A industrial zoning district. And before we enter into the public hearing, I'll turn it over to our planning director, David.
Thank you, Mr. Mayor.
Thank you.
This is ordinance 2022-01. You may recall at the previous mayor and council meeting, we had a first reading that was ably handled by Mr. Gaskell. What it reads as an ordinance of the mayor and council of the town of Berlin, Maryland, establishing a crematorium as a conditional use in the M1A industrial zoning district. Be it enacted by the mayor and council of the town of Berlin that sections 108-5 and 108-557 be amended as follows. Now, the first one they mentioned, 108-5, is the definitions section of the zoning chapter. And the only thing that was added was under crematorium. It's alphabetical, you'll see in your packet. It's in capital letters. Crematorium means a building or facility containing furnaces for cremating dead human bodies. And then if you go to the second item it mentions in the header, section 108-557 are conditional uses that can be possible in the M1A industrial district. If you go down to item number 18, again in capital letters, it says a crematorium as defined in section 108-5, which is what we just considered. So it's a fairly simple text amendment. It was aimed at one particular parcel that the Burbidge Funeral Home owns up on 818 on North Main Street, adjacent to the state highway garage up there, and just south of it on 818 is the Sunrise Church property you're all familiar with. There's a triangle of property there the family's owned for many years. They gave a presentation to the Planning Commission. The Planning Commission made a recommendation to the mayor and council unanimously to approve the conditional use of a crematorium to the mayor and council as a text amendment. And what this will mean is that for that conditional use, the applicant would still have to go before the Board of Zoning Appeals to be granted that conditional use before it could be constructed there.
Thank you. So with that being said, we'll open up the public hearing on ordinance 2022- is it 01? Is the agenda incorrect? Is it 01 or 03? 01?
01.
Okay. So 2022-01. Anybody from the public that would like to come up and speak, you're more than welcome. Come on up, name, property address, or who you represent.
John Balkley with Frost & Associates. I represent Berlin Living LLC.
Adam Wesley, I'm the owner of Berlin Living LLC.
And Bradford Kirby, I'm also from Frost Law.
Thank you. Thanks for joining us. Go ahead. The floor is yours.
Sure. So we were making Vikings conversation earlier. If I jump off, not threatening. Used to being in the courtroom. I'm calm.
There's no need to stand here.
I know. I want your camera.
What did you say the property was supposed to get? Because I didn't do that.
They was
For
property.
Berlin LLC.
It doesn't have an.
Okay.
It's across from
It's
Sunrise.
across from the.
Right.
Correct.
But I didn't hear the address.
Yeah, I don't believe it has a physical address, just a tax ID number. So, briefly, and I know you guys are probably tired of sitting up there, so I'll keep this pretty succinct if I can. A couple of issues that have kind of come to our attention, or Mr. Thomas Lee's attention. I think the question the mayor and council needs to ask itself before going forward with any of this is, do you want a crematorium at the gateway to the coolest small town in America? I'm not sure if you're familiar with a piece of property 2 miles north of Millsboro. There is a crematorium 900 feet off the road. It's an atrocity. There's just smoke pouring day and night. I don't think we really want that at 818 and 113. It just optically, probably not. To me, I grew up in Selbyville, so I love this town about as much as anything. It's cool. It's a neat place. I grew up coming down here. I don't think that's a great way to introduce it to people that are coming. Secondly, with regard to the use of the facility itself, the EPA does not regulate emissions from crematoriums. So with that being said, any discussion previously about the efficiency or the effectiveness or anything else of this particular unit is only compared against units that are similar. There is no EPA regulations, VOCs, mercury, anything like that. It's just wide open. There was no discussion of that previously at the Planning and Zoning Commission. So that gives me a little bit of pause too, particularly with the Kitts Branch tributaries being so close by. With regard to the Planning and Zoning hearing, excuse me, a little dried out. With regard to the actual hearing, I think there were a few, I don't want to call them misrepresentations, that's not fair. But I think that the way that certain things were described, is particularly the surrounding properties, was colored a bit differently than perhaps it should have been. That church is less than 200 yards south of there. A northwest, northeast, or north wind is not uncommon here in the summer and fall, with storm systems that move through. There's a concern with heavy metals and VOCs being blown south to a church, mind you, a food pantry, a fruit store, things like that. Additionally, there was discussion of a tax upside to the town. How big can the assessed value of this crematorium really be? How much is it going to increase your tax base? Several $1,000s maybe in assessments? I don't really think the juice is worth the squeeze there. And that's just my opinion. It's for you to consider. On the flip side of that, I think there's huge tax downsides to this. I think that putting a crematorium there can cause a revenue issue for the city moving forward, or excuse me, the town moving forward. There have been a number of discussions that Mr. Abu Salih has had with various developers to do either large tract development, not packing 500 townhomes into a little tiny square, larger tract development that's going to be appealing to the eye. And that kind of fits in with the rural nature of that in Berlin. So that's really going to, I believe that, and this isn't necessarily an economics argument, but it's for the growth of the town. I believe that that's going to deter further investment in these properties. It's also going to probably deter developers who'd be willing to make those investments in this end of town.
Mayor, if I may, real quick. What's before us tonight is the text amendment. There's not any discussion right now regarding the construction.
No, I understand that. I think that my request for the council would be to table this until there was some more time to do the homework. If we put this,
I want to fully hear what you have to say.
Sure.
That's the purpose of the public hearing.
Sure,
To
and
hear what you have to say.
I appreciate it. And I think that the most important part of this is how this kind of got before the town. This is not meant to sound as a slight, this approach is more of a procedural backdoor to get this in. Once this is in the code, it's an allowed use. There is still a conditional use hearing, of course. But at that point, it's there. There's only one track that this is going to go on. Mr. Abu Salih's most certainly not going to sell his piece of property to allow this use to happen, which only leaves Mr. Burke's property, which I believe Mr. Engelhardt said this is directed at that particular parcel, which sounds like the equivalent to a spot zone, which is problematic on the legal side of things. Not that I'm here to make a big fuss about that. But with that being said, I think the council needs to take some time to review all of this. I know it's a lot, and I've packed a lot to a very few minutes. But I think the town needs to take some time to kind of look through these issues, particularly the environmental side of things. We'd be happy to provide anything the town needed with regard to expansion of this opposition, if that's what the town would like. I'm sure Mr. Todd would be willing to do the same on the other side.
So I have a couple questions.
Sure.
Hold on, let's let the public hearing run through, and then we're gonna ask the questions later. So
of course.
If you have anything else you'd like to add, if not, we may call on you for a couple questions after the public.
Sure. I think John's covered most of the salient points. Is having a crematorium be the first thing you see. You see the Welcome to Berlin sign. The next thing you see right next to the road is a giant crematorium. Whether it's a psychological thing, it's not necessarily what you want to have directly next to one of the main thoroughfares that brings you into the town of Berlin. The character of Berlin is part of the value, and I think it's what a lot of people cherish in this town. And to have the first thing you see be something that's very unpleasant, whether it's rational or irrational, to have that feeling, I think everybody knows what's going on at a crematorium, and it's an unpleasant thing to welcome you into the city itself. By putting that at the tip of the spear, so to speak, when you're coming into Berlin, it really disincentivizes any development towards that area of Berlin, out towards the west, it's gonna disincentivize other property owners to make the highest and best use of the surrounding plots of land. So, other areas that are residential, zone that could be subject to building homes and expanding the actual tax base of the city of Berlin, more people that are paying taxes into it, more workers, more sustainability here. I don't know about the members of council or the mayor, but I certainly wouldn't want to build a house next to a crematorium. And I think it really minimizes, so one track, if you, and again, we're not here about approving this specific crematorium to be built on this plot, but I think we all are aware of what the purpose of having this amendment is to allow that single tract of land to be developed and to build a crematorium there. One of the important things about statutory interpretation is the reason that a crematorium isn't specified already as a permissible use is because when the code was drafted, it was not intended. I don't see much significant benefit of allowing within the town limits a crematorium to be built when the county has, plenty of land where it could be built, and it wouldn't be on top of other residential or commercial uses. If it's built there, because this amendment allows it, it basically gets them halfway there. It says, okay, well, we're allowed specifically to put a crematorium there, as long as we go through the next steps. I think part of it was, by doing it this way, they didn't have to necessarily notify all of the surrounding properties. It wasn't a variance, and that's the next step. But by getting it into the code, it's already halfway there, and it's an easier battle than, for instance, going through a variance way, where you had to notify all your surrounding property owners and allow them to come to the hearing and voice their concerns or their support, what have you. I just think that there's plenty of other areas where a crematorium could be built, and it doesn't necessarily need to be in the town limits of Berlin. And the benefits of having it and allowing this to be a specific permissible use are greatly outweighed by the downsides that come from it, by reducing property values and having an unsightly and unpleasant type of business in the town of Berlin. So I think that's all.
Thank you.
Thank you.
I'm going to just get off track a little bit and get you to identify yourselves again, please. It was fast and I didn't catch it.
Yes, ma'am. Bradford Kirby with Frost Law.
Kirby Kirby.
Yes, ma'am.
Wow.
Yeah.
Frost Law.
John Bulkley with Frost Law, JON BULKELEY.
I'm sorry, spell that again.
BULKELEY.
And Adam Wesley, it's first name A-D-H-A-M, last name A-B-O-U-A-S-S-A-L-I.
I'm sorry, A-L-I.
Thank you. So I think that we need to wait until after the public hearing before we ask the question. So
You don't have to.
we don't have to?
No.
I thought that was always the practice, to allow them to speak, and then we can ask her questions afterward.
Well, you can do it either way, choose.
Let's let them, go ahead and have a seat, and then anybody else that wants to speak, and then we'll do questions at the end. Do we have anyone else in attendance that would like to speak during the public hearing?
Do we get to speak?
Yes.
I don't see why not.
All right, appreciate that.
Thank you, just name and property address, or who you represent.
My name is Joel Todd, Joel J. Todd, Attorney at Law, LLC, Post Office Box 188, Bishopville, Maryland, 21813. I represent W. Kirk Burbage, PA, trading as the Burbage Funeral Home.
Thank you. Go ahead and have a seat if you don't mind, because we do have the folks watching live from home, just so they can see everything.
First of all, I'd like to point out that my client runs a service industry. And correct me if I'm wrong, Mr. Burbidge, but I believe his funeral home is the longest established family funeral home in the entire state of Maryland. Is that correct? And one of the longest serving ones, continuously serving family funeral homes in the entire United States. I'm a little surprised that at least I think the previous presentation is trying to make it sound like I've done something sinister by following the rules that are in place to do what we're here for today, and that is to ask for a text amendment. And the issue, as pointed out by Mr. Fleetwood over here earlier, is not whether the crematorium should be built on this particular piece of property, although I'm not going to deny that in the end, when and if Mr. Burbidge gets to the point that he wants to raise the money to have a crematory of his own, this is the spot where he would like to do it. But the thing that is not sinister or secretive about this is that when that day comes, it will be advertised and the public will have notice. There'll be a hearing before the Planning and Zoning Commission, and anybody that's opposed to it or anybody that's in favor of it will be permitted to come forward before the Board of Planning and Zoning Appeals and make their positions. And then that board will be able to make whatever decision it believes is appropriate. So there's nothing hidden there. Another thing, the previous party indicated that this was a terrible place to put it at the gateway to Berlin, which made me wonder, would he be happier if we put it in downtown Berlin? Because, you know, Mr. Burbidge does have some property in downtown Berlin, but he has lived in this community. He's been in Worcester County his entire life. He loves the town of Berlin. He serves the town of Berlin and all of the surrounding communities, and Mr. Burbidge doesn't want to do anything that's going to adversely affect the conditions anywhere in the town of Berlin, and wouldn't think about putting something in downtown Berlin. But neither should he be required to have to go outside of the town of Berlin to keep his, how many years has your business been in business? Since 1810. Now all of a sudden, he's being asked to leave the town of Berlin to build something that he wants to build. Mr. Burbidge has been the one running the business, or been working with the one running the business since the 1980s. And he became the president of the organization after the passage of his grandmother in 1985, who was up until then the one running the business. When he first started working with his grandmother, the first year he was there was about 4 people that wanted to be cremated. And they had to be sent all the way up to Wilmington, Delaware to get cremated. And then the bodies, the cremains would be mailed back to him. On average, the Burbidge Funeral Home has between 350 and 400 funerals a year. And at this point, 70% of the funeral services that he provides, that the Burbidge Funeral Home provides, are cremations. There certainly is a demand for this, and that's only going to increase. Now, there's nothing to stop any funeral business from doing the same thing. If you pass this text amendment, as I think you should, there's nothing to stop the Eastern Shore Cremation Center that's currently on 113 but does their cremations elsewhere. If they wanted to apply to put one in the town of Berlin and they had property zoned for with the same zoning, they could go and apply for the same kind of a process that that Mr. Burbidge is applying for now. There's nothing sinister here. And as far as doing anything unpleasant for the town of Berlin, for crying out loud, look at the Burbidge Funeral Home that's been there all these years. And for some of you that have been here long enough to remember what it was like before this supervisor of the Burbidge Funeral Home took over, it's a show place in town. It was never ugly, but you know, the landscaping and all of that Mr. Burbidge does to make the town look that much more presentable. And then his property just on the outskirts of Berlin, Mary Sherwood, look at what he's done to that piece of property. How could anybody that is familiar with the work that Mr. Burbidge does think for a moment that he would do anything, put up a building or a business that's going to be a blight on the town of Berlin with all the years of history that he's got with this town? Let me say this. You heard an allegation, a bald allegation. I know something about bald, but you heard a bald allegation that the place in Millsboro, the smoke comes pouring out of it. To that I say, baloney. That's not what I want to say, but I say baloney. Let me tell you something. Don't you think if that was the truth, he'd have a picture here to show you tonight? That's not true. That is a falsehood. Falsehoods aren't unusual these days, but that was a falsehood. There is a crematorium in Salisbury. I bet many of you have driven by it several times. It's over there near the old Pepsi-Cola bottling company, and I've driven by there many times, and I didn't know until tonight when I asked my client, where's the one in Salisbury, that that's where it was. I didn't even know it was there. I've never seen any smoke billowing out of it. The last 5 years of my career as a prosecutor, from 2011 to 2016, I worked at the state's attorney's office over in Salisbury. And we would routinely eat lunch over there in that neighborhood. I shouldn't publicize the restaurant so long, but there's a restaurant over there that we all like to go to that's very close by. I never smelled anything. I never saw any smoke billowing. It's perfectly acceptable. There's nothing wrong with it. And I can assure you that whatever Mr. Burbidge builds to house this crematorium, wherever it's ultimately built, even if it's on this property, it's going to be a nice looking place. It'll be well landscaped, and the landscaping will be well manicured, because that's what he does. Everywhere he has property in the town of Berlin or near the town of Berlin, it's all very, very nice, and this would be no exception. There is a demand for this. It's needed. It's not going to be a blight on this community, and I'm frankly offended that some outsiders, some outside attorneys would come in here and accuse us of something, accuse me of doing something sinister by following this legal pathway, and accuse my client of trying to wreck the town of Berlin. That's simply not true, and I find it patently offensive. I believe you have, we have provided to the Planning Commission, I don't know that you want me to go through all of this again, but this is inside a crematorium, there is a ventless processing station. So there's a built-in exhaust fan and a filtration system that reduces, as far as is humanly possible, any airborne particulates from escaping into the atmosphere. The filtration system recovers dust when remains are transferred from one location to another. Everything is as clean as is possible to make it, and I would urgently and respectfully ask that you pass this text amendment. And as far as why it wasn't mentioned before, I think the point the statistics that I just showed you a moment ago, that in in the 1980s, when Mr. Burbidge first started, there was 4 cremations as opposed to 70% of 400 now. I think that shows why it wasn't there, because when the town code was built, there was no need for a cremation. People weren't doing that. Everybody was getting buried. But most people aren't getting buried anymore. Most people are being cremated, and there is a need for it. And that's why it wasn't in the original zoning code. So the nice thing about this procedure is, if you adopt the condition, the text amendment, it will be listed as a conditional use, but that doesn't mean they can automatically build it, okay? They still have to, it still has to go through the regular process, there's still a public hearing, and so the Board of Zoning Appeals would know, okay, this is a conditional use, so we can do it, but we don't have to do it. And they would listen to the public, what they have to say at that hearing, and then they would decide whether or not, even though it can be considered a conditional use, it doesn't have to be in this location if they don't think it's appropriate based on what they heard. And then it wouldn't go through. So with that, it looks to me like it's the best of both worlds. You're saying, okay, it can happen, but it doesn't have to happen. And that's what we're asking for at this point. Thank you.
Thank you.
Anything you want to say?
Thank you all for allowing me to be here today. And these gentlemen who just spoke, I know they don't know me. There's no way they could know me. I don't know them. I'm not particularly thrilled about how they described what I was trying to do because it's not accurate. When I do things, I don't do things that are going to be disrespectful. Never have. My family never has, and I don't wish to start. To visualize what was described as something that was going to be horrendous as you come to Berlin. In one word, police. That is absolutely ludicrous. It's not even on 113, it's just slightly over with a little row of trees between it. So you wouldn't even see the facility. Do you think I'm going to put up a billboard and say, essentially, here it is, you know, don't come here. I wasn't even planning to put up a sign because of respect for anybody who might be in the area. I wanted to put up, I don't know if I'll get permission or if we can get to do this, but a fence to protect the area, because I take a lot of pride in the families I serve. And it's important because they put a severe, strong faith in me. And I would never, ever want to degrade that. It's just not a part of who I am, or I'm not speaking for my Lakeland, or who any of us were. Some of you may have known my family, some maybe not, but we've been around a long time. But to describe the presentation that was describing, I can't speak honestly to the individuals that did it because I don't remember their names, but anyhow, they're doing their job. I get that. They're representing somebody who wants that not to be a problem for what they're planning to do. I'm trying to do something with land that's been in my family since the 40s. And we have a very sincere need for a service in this community to serve the community. It's not going to go away. So that's essentially what I'm trying to say. Nothing could be further from the truth as far as something that was going to be a disgrace to the town or do anything that was going to inhibit anybody to say anything about what I would be doing. Now, am I planning to build some humongous place? It would be what would be necessary to get the job done with the equipment that would have to be there. But I'm not talking about something that's going to be elaborate. I mean, as far as the size is concerned, I can't quote you the square footage right now, but for instance, the one that was described, you know, up in the Millsboro area, it would probably be smaller than that. But, and I could give you more if I had anything here, but I don't have the dimensions or anything to tell you. But it would be discreet, it would be in good taste, it would be nothing that would be a shame to this community.
Thank you. All right. Go ahead and have it. We're gonna see if anybody else wants to speak, and then after that, we can open it up to the council for questions.
Thank you.
Thank you. Is there anybody else in attendance this evening that would like to address the mayor and council for the public hearing? All right, if not, we're gonna close the public.
Don't close it,
Okay.
because you're still asking questions.
Okay. I thought that you had to close the public hearing and then the council could ask a question.
That's part of the hearing, the question.
Okay, well then we will keep it open and the council can ask questions.
I have a question for the group that made the first presentation.
Would you like us to approach?
No,
I'm sorry, not approach.
It's just a couple of questions. Now what group do you represent?
Berlin Living LLC, sir. They own the large tract of land, just west of 818, across from Mr. Berger's property.
During your presentation, you made reference to Sunrise Church.
That's correct, sir.
Do you represent Sunrise Church?
I do not, sir.
Is there anyone here from Sunrise Church?
There is not, sir.
Thank you, that's all I have.
Yes, sir.
Any other questions by the council?
Yeah, I have a question for both parties. Well, the same arguments that we heard, the same descriptions that we heard tonight, were they presented to the planning commission?
They were not, sir. We did not have notice of the hearing. We didn't find out about that until after the recommendation had been made.
And Dave, the planning commission's recommendation to us is favorable?
To approve.
Favorable to approve?
Correct.
Yep, we recommended that it be approved. And they are publicly advertised twice. It is posted on the town website, it is posted on the property, you know, when you go into the planning commission. So as far as a personal invitation, no. But as far as the requirements of our code, that was all followed.
Absolutely, I will.
Right, okay. And I just want to make sure that I understand this, that tonight the discussion really is the ordinance of allowing it as a use, not building the building.
That's correct, sir.
And Mr. Todd, can you just verify the statistics again from 1985?
It was in the 80s. His grandmother died in 1985, but he began working with his grandmother sometime in the 80s. I'm not sure which year it was. About 82. So in 82, 83, there were 4 cremations at the Burbidge Funeral Home. And now we have approximately between 350 to 400 funerals a year, and 70% of them on average are cremations.
Thank you. That's all that I have.
I have a couple of questions and a comment. So, first off, Mr. Todd, I know that you are not far-fetched when you state that 70% are now cremations. My family has been in this town as long as the Burbidge family, and I can tell you just from my 47 years, well, almost 47, that I've watched funerals, and now my family is moving more towards cremation. In the generation current, and the ones that are, you know, those of us that are at a place where we're thinking about those things. So I can understand you wanting to move your business and your family's legacy with the change of the times. I understand that. But my question is, up until now, currently, where are you having your cremations done? Like, I don't need to know the name of the company, but you have to outsource that, right?
Right.
And what does that mean revenue-wise for your company? How does that affect your business?
It's pretty hard because, you know, you have to make arrangements to have extra staff to be able to train. I'm sorry.
You're good, you don't have to stand. I
Well,
can
no,
go.
our voice carries better when we're
Gotcha.
standing since we're not up there by the microphone.
To transport, but then we have to go back and pick up the remains after the cremation is completed. It's just a lot of extra expense, and it's travel that is a risk, and we don't want to do that. I mean, we have had to because we didn't have a crematory there right in downtown Berlin. So we didn't certainly want to impose an issue with our community there, you know, because there were people all around where we have our business.
Right. So the next thing, I heard the gentleman from Frost, my Viking friends, talk about the EPA and not having true regulations when it comes to crematoriums.
Yes, ma'am.
I'm not well versed on crematoriums as far as that goes, but you guys are doing research, Burbidge family, on how to get this done. You guys are pillars in the community and very trustworthy, so I'm assuming that you checked into this, or you know how this works. Mercury exists.
Question I'd have, it ties into what you're asking. Using our power plant as an example, you have emissions, you have an MD, air quality. So question on a crematorium, is there an air quality permit with MDE?
Are you asking me, sir?
Well, that was the question to whoever knows the answer.
I'd say that I'm only actually aware of federal regulation. I could certainly look into the MDE requirement, but generally speaking, I believe that any sort of regulation with air or water within the state of Maryland is generally based off the Clean Air or the Clean Water Act, and would use a very similar variant of allowable waste, if you will, for lack of a better term.
I do not see those statistics in the research that I've done.
I guess for me, the only other question or statement or thought that's put into the atmosphere, because that's what we're talking about, is, I mean, we're talking, thanks, Sarah, I knew somebody would get it. We're talking about a crematorium in an industrial area, right? An industrially zoned area. But the concern at this point is coming from a developer or a possible land developer looking to develop housing in that area. Am I correct? Is that true?
That is possible, yes.
So the likelihood of you doing that would mean possible rezoning for that to happen, or is it already zoned?
That is correct, yes.
A downward zone.
Right, so that's where my thought question was.
If I may point out, that property is zoned the same as the property that, that's at issue here tonight. Now, it wasn't always zoned that way. That property used to be agriculture, and I don't know whether it was this owner or a previous owner. At some point, they came to the town and asked that it be rezoned, and they got that rezoning. And now they're thinking maybe of trying to go residential. And while that property owner may not yet know what he's going to do or when he's going to do it, I don't think that property owner should be able to hold my client hostage while he tries to make up his mind what he's going to do with that property. And more to the point, shouldn't be able to hold a text amendment, which isn't really conditioned on this particular piece of real estate, although, again, admittedly, that's where we would like to build it. But this text amendment would apply to any property in the town of Berlin with that zoning.
That's the only zoning in the town of Berlin. The
Your
property I
parcel.
own and that part, that's it. So if I downzone, that is the only one that's intended with this gene.
But with all due respect, with all due respect, he can't downzone unless that's approved by the town. The zoning is what the zoning is. Whether he can do that down the road or not is up to you. But right now, my client has property zoned that way and shouldn't be held hostage to some wishes he may have, that he may want to implement sometime in the future, we know not when. Thank you.
And these two properties are adjacent to one another?
Across the street from one another.
Across the street.
Across 818 from one another.
On the other side of the pit.
Correct.
On the northern
On
side.
this side.
The northern side.
My property is 245 acres. His property is 1.6 acres.
Okay, so we should just bend over and walk away because you got more land than we have.
Well, he didn't
The
say
land
that.
is zoned, what the
Let's
land
keep it-
is
It went
zoned.
from sinister to
Hold
hostile
on,
quickly.
hold on.
Yes, it has.
Let's keep it civil and about the facts. Councilmember Hare?
Yeah. He answered the question, I know where it is now.
Thank you. Any other questions while the public hearing is open? All right, we're gonna close the public hearing. All right,
Mr. Mayor, can I give the
yes, please.
council some background?
Thank you.
Please.
If you look at the ordinance, on page 9 is where the conditional uses for the M1A zoning district is. And currently, Mr. Burbidge could apply for a seafood processing plant. He could have livestock purchase and sales yards, so he could have pigs and cows out there. I just want to put.
sawmill?
A sawmill, yeah, I just want to put that in perspective. And the only thing that a conditional use would do would be to allow a property owner to apply to the Board of Zoning Appeals to approve that conditional use. And the Board of Zoning Appeals would look for detrimental impacts on surrounding properties, detrimental impacts on the value of surrounding properties, detrimental impacts on traffic, things like that. And the Board of Zoning Appeals, based on those findings, could deny that issue. But that would be at a hearing where evidence is produced, testimony, and things like that.
Thank you. Can you review the possible actions that are available to the council this evening?
You can make a motion to pass the ordinance, or make a motion to deny the ordinance.
Okay.
Or you can table it.
Thank you. With that being said, the public hearing is closed. We've heard from the town attorney, and we are looking for action of the 3 different steps available this evening as recommended, or as presented by the town attorney.
And a recommendation from the planning commission was?
Favorable. They recommended that the text amendment be put in place.
The question from Councilmember Nichols was whether that was a unanimous.
I
thought I heard that
I
earlier.
believe it was unanimous, yeah.
I thought I heard that, I just wanted to clarify. But I guess I have one last question. When it goes to planning, or when it goes to appeals, if we were to get to that stage, my thought process is that if it were to get there, that they would do the research on crematoriums and what they're like.
That's where that evidence should be presented.
That's what I'm saying,
Yeah.
at that point, they're gonna check out these other locations are possible to see how it's working elsewhere and those kinds of things, correct?
Yeah.
And I can tell you this, I sat on the Board of Zoning Appeals for a number of years, and not every decision was a cookie-cutter decision. There was many times that things were turned down, and many times things were approved. So they did
But they're
scrutinize.
gonna do their due diligence.
Scrutinize over the information and make the correct decision.
And if they approve it, they can put conditions on it, for
For sure.
screening and
And
landscaping and things like that, so it's really not even visible.
And I will say that in the planning commission, it was a public hearing also, advertised twice, just like this one was. Presentation was given of the process that would be required, and discussion was how over the years, now the technology for doing this has improved so much, and that if there are to be, we know it's combustibles, right? If there is to be dust, as Mr. Todd put it, or smoke, it's reclaimed many times, and you wouldn't, the way it was put, you wouldn't even know that it was running at the time it was running, let's say. I'm trying to be respectful of people
No, I hear
who
you, I
passed away.
understand. Or hours of operation.
And then the schematic, the drawings and again, tonight's hearing has nothing to do with the site plan approval. So actually, Mr. Burbidge, if he was to go to the Board of Zoning Appeals and ask for, it's called a special exception for a conditional use, if he asks for that and gets it, he still has to go back to the planning commission for site plan approval. He shows them a plat, he shows them where the building sits on the lot, he shows them the building, what does it look like? And then again, there would be opportunity for discussion of the system, you know, how the process works, and does it emit anything into the atmosphere that's detectable at all? And in the interim, before any of that happened, I certainly can research MDE regulations and what do we have as far as environment. But that was not presented, like it wasn't presented as MDE regulation number 105-6 says, and this equipment meets it. We did not have anything that detailed, but they did show the equipment they provided as far as our packets. The equipment itself from the manufacturer, just like, you know, in our RFP, we're talking about that lift station. The same thing, the manufacturer has that product literature, and they gave it to us in the packets as their exhibits. So based on that, the planning commission said, yeah, it's low impact. Why wouldn't we make it a conditional use? Let the Board of Zoning Appeals decide if the site is proper, and then we'll see you later when you come back for site plan approval.
And just to be clear, for the council's information, once the Board of Appeals makes the decision to allow or deny it, that is final. For the site plan, yes, it still has to go to planning.
Yeah.
But the use is a final decision. It doesn't come before council.
No, it won't come back here, but it could be appealed to the circuit court.
To the court.
Right. And it is site specific.
Yes.
And a conditional use like that, if the use ever ceases for more than a year, it cannot be continued. So if Mr. Burgess was to say, that didn't work for me, and he lets it just the building lay empty for a year, and another owner went in, or another family member, you couldn't continue the use if it lays fallow for a year.
In keeping with the work of the planning commission and the recommendation of that group, I would like to move that ordinance 2022-01 be approved.
I have a motion to approve ordinance 2022-01 by Councilmember Burrell.
I second that.
I have a second by Councilmember Nichols. All in favor, say aye.
Aye.
All opposed? Let the record reflect that ordinance 2022-01 passes unanimously. Thank you.
Thank you all.
All right, up next, agenda item number 8 is the first reading of ordinance. My apologies. Earlier, I think I said that ordinance 2022-01 was -03, and I was looking at the tax rate. The daylight savings time really played a number on it. So let's move on to agenda item number 8, the first reading of ordinance 2022-03, establishing an FY23 tax rate. The public hearing for this will be held on March 28th, 2022, and the Finance Director, Natalie Slay, will run point on this.
Good evening. Today we have ordinance 2022-03, introducing the real estate tax rate for upcoming year fiscal 2023. The ordinance and the yield calculation above was advertised in the local newspaper on Friday. Would you like me to read the whole ordinance?
No, but if you don't mind, well, do we have to, Gaskell?
No, you can, it's very short, you can just summarize.
So the ordinance is introducing the current rate to be at the same as fiscal 2022, which is 81.5 per hundred of assessed value of real property located within the town limits of Berlin. This rate applies for residential and commercial properties at the same level. This rate is above current yield, which went as advertisement in the newspaper, as I mentioned. So this is the first hearing. It's an introduction, and we're open for questions, discussions, comments.
Do you have the constant yield rate that you can share with everybody?
Sure. Pull it up.
And just so that for everybody watching at home, the constant yield rate means that at the rate that the finance director is getting ready to say, our revenues would be unchanged from FY '22 to FY '23.
I don't have it to project on the
That's
screen, but I can just summarize. So basically, the current yield is 0.7860, which is 3.96 or rounded to 4% above the current real estate tax rate, with assessed value being changed from year to year, and the current year has been a new assessment. With the same current rate of 81.5 per 100, town will generate $144,740 additional revenues.
Thank you. Any questions for the finance director as it relates to ordinance 2022-03? This is introduction, so no action for first reading. All right, thank you. Up next is agenda item number 9, which is discussion of the future allocation of casino revenues. So I asked the finance director to prepare what's in our packet this evening, outlining the casino revenues from 2017 to present. The reason that we're doing this is because previously those revenues have been used to pay off or pay ourselves back for the construction costs of the police department located on 113 or Decatur Street. With that being said, there's a projected payoff rate, and that's using these figures that you have above from 2017 to 2022, of in or around December of 2022. So with that being said, it's important for the town of Berlin to identify our priorities as it relates to that funding. The parameters of the funding you can see here are pulled from the 2007, I believe, Senate bill that outlines the different types of way that the town, or the different ways that the town of Berlin can allocate that casino funding. We do have to send in documentation annually, right, Natalie?
Yes.
As it relates to how those funds are used. With that being said, we do have a good amount of money that we could redirect in a certain pathway. Part of that, the town of Berlin previously had explored providing LEOPS benefits for our law enforcement officers. It's a law enforcement officers pension system. When we looked into that system, it was going to cost an additional $250,000 a year, thereabouts. With that being said, we did not have the funding at the time to be able to do that. With this potential payoff date coming around December, and with us moving forward, you'll see in the FY23 budget, I'll be requesting that we update that LEOPS study. That's required in order to bring the numbers current for us to understand what the cost of LEOPS would be for implementation. With that being said, once we have an up-to-date study, we would be able to move forward with that benefit for our officers. I don't anticipate that number fluctuating a whole lot from the roughly $250,000 increase annually. So a portion of this money, I think, needs to be on our radar to reallocate in that direction. So this is a discussion item. It's not a formal action this evening. If there's anything that you would like to know more about, any information we could gather or send to you. I know you've seen the previous studies for LEOPS. I know we've talked about the system before. I know some of you have mentioned to me that you would like to see this funding allocated in that direction. I agree with that. And it really is a discussion item for this evening.
So my question on this is, LEOPS may be a worthy cause, but I think we should do our due diligence and explore other things the town may need to fall within these categories. And so, I don't know if Jeff can answer that question. What are some other major needs the town has that would fall under this funding criteria?
Well, if I need to be corrected, please do so. But again, it's a decision of the mayor and council for what the allocation would be of this money with the approval. I think it's called the
Local Development Council.
Local Development Council. But the prior administration, the talk was anyway, once the police station was paid for, those monies would be redirected toward a community center. But as far as, that's what the prior administration had discussed. We were not even close at that point with payoff, so there was no discussion, regarding what we were, no formal discussion anyway. But as far as other uses, I mean, it's laid out in front of you. And again, that's a decision that you all will have to make with the approval of the organization that Mr. Gaston refers to.
So who makes up this local development council?
Ivy is one.
Yeah, there's a group of members that are appointed by the county. They're also defined within.
What, LMB?
I don't think, there is no representation for the town of Rose. G. Williams was the previous member of the.
Ivy is.
I thought, I didn't think you were.
Yes.
I'm sorry, I thought that we did not have representation on the LDC.
We got Ivy there.
Okay, I stand corrected.
Local management board is actually different.
So it also,
So, okay, go ahead.
It's not the LMB.
What is study to be completed?
The study takes, it's not as long as, the study itself does not take the duration. It's a matter of lead time for it, like when we were talking about the appraisals. We're looking at about 6 to 8 months, I think, for a return on that study. So we would be in line with passing the deadline of December, probably the payoff deadline that we have here for ourselves.
And the thought is that the casino funds are gonna stay roughly around the $250,000.
Well, that's the
Or
thing.
thereabout.
That's the thing. You're looking at the 271 for FY '22.
Yeah.
I would say focus your attention more on 21 to 17, just because those numbers are full year amounts. If you're looking at the FY '22 numbers, those are as of March 9th. So
300 to 400,000.
yeah, I would say about, that's a pretty good assessment.
And actually, we received, the numbers for this past month from the casino. Kelsey sent those out, and if.
33,000.
Right, and then if you add those up from July to December, we're already at 304.
Yeah.
So, LEOPS may not take all of the revenue that we could potentially receive.
But
If we were to go that route.
do we
If we were to go
know,
that route.
do we know what LEOPS will take before the study is completed?
No.
I heard the mayor give a projection, but.
Well, I believe the study would determine,
Do we know?
So
I think the study would determine what the final cost.
If you look at the previous study that was conducted, and it's in Excel, and I believe all of you have it, but we can also send that out again.
I have email problems right now, so I can't see.
So we'll make sure that you have it, but what that study shows is over, I believe it was a 10-year period on that Excel doc. And it shows what those numbers are. It's not a straight amount for all 10 years. It does fluctuate a little bit, but it's about $250,000. And to your point, we won't know the full cost of that probably by the payoff point, but we can allocate that funding for that source and say, hey, look, we're anticipating the study to be completed at this time, and at that point, we want to redirect.
And Mayor, if I may, if you go the route, correct me if I'm wrong, Chief, the study would be done in FY '23, and then the actual startup would not be until FY '24.
Right.
We would have the ability, we would have some funding there, and to the point, once we understand what that full cost is, it doesn't say that future revenue that exceeds whatever that amount is, could not be reallocated. And we've also discussed some other metrics that we could use to help offset some of that funding. So is it the goal to long-term always satisfy that expenditure with this casino funding? Not really, but I think you're gonna need to offset that item somehow.
Well, this is gonna be an annual payout.
Yeah, this would be an annual payout.
In perpetuity.
And I also think that if whatever we decide to do, I mean, we should probably develop some sort of sustainability plan in the event something, God forbid, happens to the casino where they're not getting any revenue, like a pandemic.
Right? That's what I'm saying.
So yeah.
Does the cost of LEOPS increase every year, like cost of living adjustments, or?
So I'll defer to the town administrator, but sometimes what you'll see, even with so our current employees are part of the Maryland State Retirement System, right? And sometimes what you'll see is that percentage shift. So there's a percentage that the employee pays out, and there's a percentage that the employer picks up. And sometimes you will see that percentage change. It's not changed a whole lot in the past several years, but I think there was a adjustment.
Prior to 2011, the employee's contribution was about 5%. the employer's contribution was almost 8%.
This is Maryland, not Leon.
This is Maryland State Retirement Agency.
It was before then, but what happened is it moved up to 7% with the employees and the balance being out there paid by the employer. When we look at the actual number, it's not 250,000. It's less than that because we have a $33,000 credit. Also, with those numbers, we get paid in free. Generally, agencies have to go ahead and pay in to get their employees. We've had so many employees leave before they're vested that all of the town's money stays inside the pie. So right now, you have a big pot of money just sitting there because employees have left prior to being vested. That being 5 years in the old system, 10 in the current system. So again, that makes up the buy-in, 0, a credit that goes on for a long period of time. So again, to say numbers without the paper in front of you, I think it's gonna be a little bit much. And if you say $250,000, it kind of scares everybody. But when we look at it, it is what we pay right now and the difference. It is not the difference. It's not whatever that percentage is. You have to go ahead and incorporate what you're already paying as a difference.
But to your point, and again, I don't have the numbers in front of me on this. I know that this year, for FY '23, the employer cost for not only LEOPS, but also for the program that we're in now is going up just a fraction.
But if all of a sudden, you know, let's say Berlin's prospering, and all of a sudden you decide, I need 20 officers versus 14, the cost of LEOPS would go up significantly.
Yes, but that's not for him to say.
Well, he would say, I need more officers, not.
At that time, not him.
And,
But that's the
and again, I would make this statement, and I think without all the facts and everything, I think we just really want the study to happen. And then when you see the numbers in front of you, you get to go ahead and make a decision.
Yeah.
Again, the only thing we can say is everybody else around us has it. Federalsburg, Snow Hill, Chrisfield, and us are the only ones don't. So the question comes back is, what are they doing fiscally to get to this point that we're not doing? And again, if you talk about Chrisfield, if you're talking about all those other entities, they don't have any income at all.
And I wanna echo something that the chief told me probably 3 years ago, that in my humble opinion was probably the most prolific thing that I think I've heard from the chief regarding LEOPS. Had a huge impact. He nailed it, but he didn't use the words that he used with me. He shared with me that all these entities have LEOPS. We do not. It's called priorities. So I absolutely agree with the chief on that.
But now the other side of this is that, and the chief and I talked about this over the phone. There was a time, I would say 2008, 2010-ish, where we were all talking about LEOPS and the town of Berlin as a whole, along with the fire company, because it does include fire and EMS employees and law enforcement officers. We were talking about it, and at the time, virtually nobody had LEOPS as far as I think the sheriff's office was the only one at the time. And now that has totally shifted to where Berlin is one of the few without it. And is it the defining benefit that causes an officer to stay or leave in Berlin? Probably not. But there's a reason that the Maryland state retirement system is defined by different pension systems. And for law enforcement officers, for fire and EMS, it's a 25-year benefit. You look at correctional officers, it's 20 years. And that's adjusted based off of the demands of the job. It doesn't mean that we don't value any other employee or anybody that's in this room. It just identifies that the job is a little different and takes on a little bit more risk in certain areas. So there's a different benefit.
So this credit, I'm looking at it, thanks to town administrator, but looking at this credit, it looks like it's consistent until 2029. This number is
And
the
again,
number?
that's the old study, so we look at the new study, and again, it might be more favorable.
Okay.
Or it might be not as favorable.
We're gonna be pretty close.
Gotcha.
And to the other point, the chief mentioned that we do the study, we get the table that Councilmember Nichols is looking at right now. And I can tell you, for at least for me as a council member, when we received that information, it's not that we didn't want to move forward with that benefit. We didn't have the funding to do that. So the thing is we just heard a moment ago that by keeping the property taxes unchanged, we're getting a revenue source that's going to increase by $144,000. It doesn't cut the mustard for this benefit. So really, we have to look at what other options do we have available. And I think we're getting ready to hit a position where we are going to have some funding that needs to be allocated in a certain direction. Do I think that a community center is off the radar? Not at all. But I think that this could help point us in the right direction for a little while to stabilize it.
So what is the difference of doing that allocation now as opposed to after we have that updated information?
So the thing is that I'm not asking for any of that tonight. I just wanted to have a discussion to put this on everybody's radar. I think we need to look more into the system itself. I think the chief needs to do something.
I do too.
But the thing is that we do need to have the discussion before the payoff point hits. Because I think it's important for fiscally for the town of Berlin to say, all right, we need to have a plan for this money. I don't think it's smart to allow that money to get fully paid back to ourselves for the police department and then not have a plan for it. I think that board looking at us is gonna wonder what other ways that money could be put to use. And we need to have a plan for it.
And you're referring to the casino board?
Correct.
If I may, since I do sit on that board, because LEOPS isn't actually, I know that it says public safety, and I fully agree that we should move forward with LEOPS. I'm not necessarily sure whether the vault funding is
The way to move forward.
well, it could be, but there's some steps that need to happen in order for the town to be able to use this funding. It has to go in front of the board, and the board has to vote on it, and then it has to go to a public hearing where the community votes on it.
And this is also, David Gaskell has done the research to find that this is a possible use within the
Parameters.
But Ivy is correct that there is a process for that.
There's just a process, so I just wanted to make sure that you understood that.
All right, any documentation that this council believes they need in the upcoming weeks or months as we get closer? December is going to be here before we know it. I'd like to have a plan. Typically, we submit that paperwork before December for the annual portion, correct?
Well, the reconciliation paperwork for what the money's been spent goes after the fiscal year complete. For the process that Ivy describes, that should be ahead of a time for future allocations.
Okay.
May I just add something for consideration? I totally concur that the second plan should exist because slots revenue is a variable, and the same thing is LEOPS. They're both variable numbers. They go separate ways. It could one go up, one could go down. So LEOPS precede slots revenues can cease at any day, and I'm not saying that's going to happen, but pandemic proved us wrong when they were shut down. So a solid plan should exist in place before we approve the allocation as a backup plan. If something goes unexpected, the funding should continue on from other sources.
Yeah.
It's not something we can opt in and out of.
No.
So basically, you're saying in mom terms that we have to, we need to prepare for possibly the casino funds not always being available.
We have to have a plan B.
Yeah.
Most definitely. Second set of diapers.
That's reasonable.
So, all right, thank you. Let's move on to agenda item number 10, which is the board, commission, or committee appointment. And with that being said, I am requesting to nominate, I am recommending Brian Robertson as a new appointment for the Historic District Commission. That's going to be for a 3-year term. We interviewed Mr. Robertson with the other applicants that applied during the first vacancy that we had. Mr. Robertson, you may be familiar with him, he is a graphic designer. He was also one of the applicants that was familiar with the town code and is a resident of Berlin and lives in the historic district. You may ask yourself why that's important, but the historic district is identified in the town code as having somebody on the board that lives in the historic district. We have other members, but it doesn't hurt to have people on there that also live in that district. So with that being said, I'll take any questions regarding
Yeah, I'll just
Mr.
ask
Robertson.
again, it would be nice for the council to have the background information. We asked that before, I think we did it once, but.
So when you say the background information, I try to give like a couple lines. That's why we started the couple lines below. Is there something
Well,
in
he puts it-
particular?
he puts it in an application.
Right, so I don't know if it's our best practice to share applications per se.
Well, not even just the
We don't
application,
do
just the
that for
highlights.
employment. But if there's something particularly interesting that you would like to know for applicants, I would.
There's questions on that application as to why he wants to be on the.
It could be done there only for the council,
Yeah.
not the public package.
Okay.
Yeah.
I would like that information also.
Yeah, I don't think for
I mean,
the
I know
public.
Brian, and that's fine, but some of the applicants I don't know.
And that's good, but I interpreted what you requested originally. That's why I started putting the lines in, but we can share the.
See, I think, I think whether we know the information, know the individual or not, I think that type information just needs to be standard operations. Whereas the applications, they're complete with the replies to some of these questions that we may be interested in knowing would be most beneficial.
And I have to agree, and the one thing that I will say, you say standard operations, I agree with that, but this is a whole new process, including taking applications, so it's very helpful to hear the things that you would like to see, so that we can make sure that we provide them.
Standard.
And so we are writing the new standard operations, so we will make sure that that is included.
So while we're talking about boards and commissions,
Yes,
I feel like this is deja vu.
yes.
Mr. Mayor, state again for us, which boards and commissions still have available seats?
They're online, because I don't know them off the top of my head.
just
I
thought
will,
you knew that.
but I will say that we have Ms. Hanbury here, and she's on my list to interview. But we have applicants that have applied for beautification. We're gonna get ready and do those interviews. We're gonna get ready and do the interviews for A&E to get that board appointed.
Can you tell
There
us what
are
A&E means, please?
arts and entertainment.
Thank you.
There is one that is on the top of my head, and Mary will love this plug. We have 4 positions that are, new positions that are open for the Board of Elections, and that is very crucial to fill, given that we do have an election that is a little over 6 months away. So all of those, a current list of the vacancies is available online.
So Board of Elections, does that, I mean, I know what they all are, but when it comes to the Board of Elections, the application process that you just instituted with Board of Elections, is there an additional one, or is it just?
No, it's the same application. We tried to standardize that across every board and commission. We've been very lenient with resumes, so don't let that deter anyone. I've had them written on a napkin. I've had them handwritten. I've had them professionally typed, professionally designed. We don't grade on the appearance. We just need the substance, so.
But any training that they will need.
Is
to make
provided.
it- Okay.
That's why it's important to get those applications in. It's important for anybody that's interested to go online and submit that so that we can move forward with it as quickly as possible.
Do you need a motion for this?
We do.
I'd like to make a motion that we approve Brian Robertson for the Historic District Commission.
So I have a motion by Councilmember Nur. And then second by Councilmember Orris. All in favor say aye.
Aye.
All opposed? And let the record reflect that Brian Robertson has been appointed to the Historic District Commission for a 3-year term. No, I mean, any helpful feedback in this process is really good. I think it's about making things easier to understand for everybody. All right, let's see. Item number 11, Town Administrator's Report.
Good evening, Mayor and Council. I want to, first of all, Tony Wigg is not here, but I do want to put a plug in for We Heart Berlin. Tomorrow, Jimmy Charles, who just came back from a fun week in Florida, he will swing by Mr. Wigg's domicile and pick up a swing that We Heart Berlin purchased for the town, for Stephen Decatur Park. And that swing,
It's the parts, I think it's parts, but the swing is still in order.
yeah, but it's a swing that you can basically.
ADA young
Yes.
child swing that's at the park that had a couple pieces broke. It took about 8 weeks to get just the parts. And swings, the whole another replacement was not available till May, I think so we're getting the parts, get this, swing back so young children and autism children would not fall out of that swing. And then, when we get, correct, and then, the new swing, we might just add in that area, so we have 2 of them, if that's the way the directions.
So the segue is perfect. Time is what it took to get this. And again, I'm gonna reiterate for everyone in this room that orders anything. Tim, real quick, what'd you tell me the other day on Transformers?
The waiting times?
Yeah.
Anywhere from 80 weeks to 100 weeks.
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 Okay, weeks. Okay.
That's 2 gestations.
Jamie?
Meter pit, 16 to 24 weeks.
Okay. So it leads me into, real quick, 105 Washington Street, the stormwater project that the council approved, waiting on material. The production well number 3, waiting on material.
To back up, since Jeff brought that up, April 11th, they're supposed to mobilize. April 18th is a Monday, they should start drilling. If the screen comes in, we're waiting on a 12-inch stainless steel screen, 30-foot long. He says that's a tentative schedule as long as the material get in here, but as what Jeff just related to, material is slow coming.
What project?
Well, number 3.
Well, number 3. I have Tim, I just want to remind Tim, when you go around, Tim has something to share where he went west, young man, and did a good deed for the town and also for a sister utility. Natalie is, and I started the process with enterprise budgets, that's going on this week with department heads. I sent an email to the mayor and council. There's a whole bunch of meetings over the course of the next weeks. So be attentive, please be here because you are needed. On the 22nd of March, which is right around the corner, we have the bid opening for the meter RFP. So that's coming here real soon as well.
That's your birthday?
When?
22nd, she's gonna be 21.
22, 21, 22.
I'm gonna buy him his first beer.
But that's pretty much what I have.
Thank you.
That concludes what I have.
Thank you. Any questions for the town administrator? All right, departmental reports, and we'll start with Ivy Wells, Economic and Community Development.
Good evening, Mayor and Council. I just wanted to remind everyone that there is a job fair at the Berlin Library on March 16th from 3 to 6 p.m. We have applications representing the businesses in downtown Berlin, plus the police department, and also another position that the town is hiring for. And Take Pride in Berlin Week, mark your calendars, it will be April 17th through the 23rd, with cleanup day being the 23rd, and more information about that in the next few weeks. That's it.
Thank you. Any questions for Ivy?
So the Take Pride begins Easter weekend.
April
17th.
I don't know when Easter is.
Yeah.
17th.
The Monday.
Up next is our planning director, not planning and zoning, but planning director, Dave Engelhardt.
I don't have anything further, Mr. Mayor.
Thank you. Any questions for Dave? All right, up next is our electric utility director, Tim Moore.
Good evening, Mayor and Council. I might be a little long-winded tonight because there's been a lot going on the past couple of weeks. As far as the crew and what we've been doing, over here on Pitt Street on the corner of the building that's being renovated, we converted that from overhead to underground service. So the overhead wires are no longer there. North Main Street, we did some prep work there for some new underground primary and a transformer to serve a new commercial customer. And then also over at Food Line, we had a second outage that occurred there on March 6th. We had one before that back around February 24th, I believe it was. What we found out is the Food Line shopping center, I guess they had installed some new equipment there and they were actually exceeding the demand of the transformer that fed that store. So basically we had to go in there and separate it from a different transformer just to relieve some of the load on it, which so far has taken care of that problem. Also, March 7th, 8th, and 9th, let me back up a minute. I was called a week or two prior to that by one of the employees of Thurmont, Maryland. They had actually had a severe accident that had occurred at the town, which had to deal with electricity. I have some pretty graphic pictures, but I'm not going to show those. Anyway, they requested if I could come there and kind of give some guidance to the mayor of Thurmont, all the commissioners, including the electric department personnel, on ways to improve their utility, the operational side of it, the safety of it, and the training that goes along with training the employees to work with an electric utility. They pretty much did not have much training at all, and so I kind of gave them a guideline on what they could do to improve things and make things work better, which I really appreciated them asking me to come there. That meant a lot to me to have, another town reach out to me. There's only 5 municipalities in the state of Maryland that have its own electric utility, and Thurmont is one of them. So I really appreciated them, asking me to come out there. And then also, I wanted to talk about what Jeff touched on about materials. Transformers, we normally receive them in 14 to 20 weeks. Now we're looking close to 2 years, could be up to 2 years. Anyway, we have some developments that are, there's discussions of some townhouse developments coming into town that are going to require transformers to produce power to serve to them. So I reached out to Jeff and I talked to him about it, and I really need to place a pretty large order for transformers. So we're talking up around $70,000. I need to go ahead and place that order now to get it started, because we could be looking up to 80 to 100 weeks to receive them. We do have transformers in stock right now, which will hold us over, if we were to lose one or that type of thing. But I really need to go ahead and order these now.
The money was in 22's budget?
Yes, but we wouldn't be paying for it until 23 in the next year's budget. So anyway, I guess I'm asking approval to go ahead and be able to do that, because I have to get it on the budget.
Tim, can you just clarify, are these usually reimbursed by the developer?
They are. Most of these transformers that go out, we may have 3 or 4 throughout the year that fail that we have to replace at our own cost. So most of the transformers that I'm ordering will be reimbursed by the developer as they build the different projects out and that type of thing. Most of these are 50 kVA transformers, which basically I call it the bread and butter. That's the ones that you normally see in a residential neighborhood that serves 4 or 5 homes. And that's what the ones I'm really ordering is those transformers.
And the funding is in 22's budget.
And in the future, we're going to make sure that these are packet-worthy action items.
Yes.
I'm of the opinion if you can order it from your phone right now, go ahead.
Oh, okay.
I think we need some official word
Actually,
on that.
they reached out to me today and asked me if I was placing the order, and I said, well, I can't tell you until tomorrow morning.
So the funding is available in FY
We
'22.
will encumber from capital outlay fiscal '22 what's available and then carry over to '23. I don't believe the whole 70 was budgeted, but if
No.
it's needed, we will just encumber what we have and rebudget for fiscal '23. But again, this is gonna be order for future in case of the future development.
Can you
To be
send us
reimbursed.
the financial numbers associated with this, following, or tomorrow, please?
Sure.
Thank you. And then we will need action on that.
Move to approve Tim's request.
So I have a motion by Councilmember Burrell,
Second.
second by Councilmember Orris, all in favor? All opposed? And let the record reflect the $70,000 expenditure for transformers has been approved.
Thank you.
Thank you.
I have one last thing. I had a school teacher from Berlin Intermediate School contact me. Her name is Kelly Powell.
I work with her.
Oh, you know? Okay. I'm just gonna read this, so just that you know about it. So, Mr. Lawrence, my name is Kelly Powell, and I'm a teacher at Berlin Intermediate School. My 6th grade enrichment students are working on an electricity unit. Within the electricity unit, they must choose a section of downtown Berlin to electrically wire in class and investigate for a potential power outage. My plan is to take them on a walking field trip to downtown Berlin so that they can become familiar with the area that they will be wiring. During the field trip, we'd like to stop by the power plant to take a look at the plant, which we will pass on our way. She wants to know if it'd be possible if they could go to the plant and an employee could speak with them about how the plant actually operates. That field trip is actually going to take place tomorrow. There's going to be 2 of them, one at 8:10 and then one at 9:30. So Jimmy, I just wanted to let you know there'll be some 6th grade students at Public Works. So if you could tell them just to watch the vehicles when they come in for the kids, that type of thing. They're also going to go around, I think Ivy, I told you about this, they're going to be going around the downtown area, kind of like doing a scavenger hunt to locate different electrical elements. So they're going to leave the power plant, walk downtown, and look at some different electrical things. So, okay.
That's pretty cool. Make sure you get some pictures and stuff as well.
I will. Thank you.
Thank you.
That's exciting. They have, I will tell you, they've been doing a great deal with this electric thing and that in Kelly Powell class. Watching them set up their little mock towns and wire it, or set up the electric in their little town. I have pictures, because I think it's great. That the kids, students, are interested in something that's taking place right down the street from them. That's great.
Thank you.
Anything else? I have a question for you. Can you, I was just at the Little League's celebration for the softball and baseball team that we acknowledged here for winning states. We're getting ready to start up with Little League season again. When I was out there, I think the scoreboard may need some help in the electrical department. Can you
Okay.
maybe coordinate with the county and figure out what we need to do to get that working?
No problem.
Because I also understand the Board of Public Works approved a sizable investment in lighting changes down in almost $1 million in improvement.
Yeah, I actually met with the supervisor of the fields on that project probably, I'm gonna say 3 or 4 months ago. And he was talking to me about what had to be done here.
Thank you.
Thank you.
Also, I think to Thermont's point, it's pretty awesome to see that of the 5 electric municipal electric utilities in the state, that's a mouthful, that we're able to share knowledge like that. I know that we lean on Easton Utilities sometimes for some assistance, and it's nice for us to also provide that to Thermont and others as well.
Yeah.
So thank you. Any questions for Tim? All right, up next is our Chief of Police, Arnold Dowling.
Good evening, everyone.
Good evening.
We've actually been doing our homework. Alexa Poll has actually been sending us
the updated policies, for our review and, our suggestions. We've actually gotten through a whole lot more than what we thought we would have in this period of time. And the reason being is they're already done with so many Maryland agencies already. So the things that we have caught mostly is changing terms that we use versus what the sheriff's department or someone else would use. And in each section, they go ahead and they show best practice, federal law, state law. So again, the command staff has been reviewing them. Once we get to the point of the first review with Lexipol, everything comes back to Mr. Gaskell, and he's gonna go ahead and review them, then we'll put them before you guys to actually approve. So just letting you know that the process itself is a lot smoother than we anticipated, and we're very, very glad of that. I know that everyone most likely have heard about the tragic accident that happened right outside of town. And what we got back was that one of our officers was one of the first ones there. And because of his actions, we're gonna be looking towards giving him a citation of excellence or life-saving. We know that he either tried to go ahead and get into that car, which was still burning, and he either made sure that neither one of them got burned. And he got injured in the process, but we're reviewing everything, and we're very appreciative of him being dedicated not only to the service itself, but human life, and going, you know, to that stretch to do his best. And again, that doesn't get, you know, reached out a lot of times before you do accommodation, but we want to go ahead and say it while everything's fresh in minds. We want to go ahead and reach out with prayers to all the families involved. We're praying that the other individual does make it through. But again, I know it was very stressful for him, and again, I think he's well deserved of this, and we'll keep you up to date on that. That's all I have.
Thank you, Chief. I hope the officer's okay as well. Any questions for the Chief of Police? All right, up next, Gaskell, got anything?
Got nothing.
All right. It's a good day when you have nothing. Up next is our Finance Director, Natalie Slade.
Jeff has mentioned we're working on budget for utilities, and I just want to bring a couple of dates. So the budget workshop enterprise fund for capital only will be on April 11th at 6 p.m. And we have a general fund budget workshop for the fiscal 23 just general fund budget is April the 4th at 5 p.m. Enterprise fund budget workshop after we discuss the capital will be April 18th at 5 p.m. I want also bring to everybody's attention, and so everybody who's listening will call a customer service, town hall, and update their emails on file. We will be launching to go paperless with the utility bills in the nearest future. I don't have a date yet. We're working with Tyler and Carts Technologies to implement this feature. So far, we've run the test trial and it went fine. We will be putting some news ads on media, and also probably we'll do the Stuffler, and we'll come up with some creative information that will draw attention of people to basically update their emails. So once we have all the emails for customers, we'll be able to do the e-billing, no papers going forward.
Is this an opt-in or an opt-out?
That people who would like to opt out would let us know they will not participate.
I thought that when we discussed this in the budget meetings, we discussed that this was something that was already in existence. Is that factual or?
What we have in existence is the optional emailing. We did not have going paperless completely implemented.
And we've not discussed whether that's going to be an opt-in or an opt-out feature. I think we talked about possible pros and cons associated with both. But I don't think that we decided one way or the other with whether that was going to be an opt-in or an opt-out.
It's still in work in progress, we're
Okay.
still working on it, we will see how many people will be interested so far. We have some interest from people, but having email in our system on each account, whether they would like to go paperless or not, it's a good option to have in case we will need to communicate or email some information in the future.
Thank you. Any questions for our finance director, Natalie Slick?
Not a question, Natalie, and I'm really excited about the paperless. Just while you're investigating everything, just keep in mind those who maybe not technically savvy or
Absolutely, it's not mandated, not mandatory. People who would like to participate and people who would like to receive their bills in paper will still have that option.
Okay, thank you.
Any other questions? Thank you. Up next is our Water Resources Director, Jamie Lathrop.
I have nothing, I spoke enough earlier.
Thank you. Up next is our, back from vacation, MHR, Public Works.
Hello, Mayor and Council. Quick couple things. I'll get with Natalie and talk about the job fair, make sure that the superintendent position.
Get with who?
Natalie, he's still on vacation.
Ivy, and make sure that the
His
superintendent
brain
position
is all sunburned.
is, make sure that the superintendent position is at the job fair this week.
Send it to, we'll talk tomorrow.
Second thing I have is, next couple of weeks, we hope to be out in the parks, addressing and getting the parks ready, cleaned up for spring, although they're flooded right now, so.
Getting them cleaned up for cleanup day.
Yeah, we're not gonna, we'll just keep our jobs going on from there. The third thing I have is, we're talking about wait times. An automated trash truck, I was speaking with a dealer the other day, and they're over a year to 16 months. And I think that's in my 23 to 24 budget, so it's something we would actually kind of have to, talk about in the next 6 months about something. And then the fourth thing I have is a plan B for slot money would be a nice Berlin Public Works building.
Very nice plug.
That's all I have.
You're welcome. I have a question for Jimmy. And I don't know if it's for Jimmy or it's for, Jamie. The street cut on.
That's me.
On Shaw Street.
Yes, sir.
When is that gonna be?
And, well, the blacktop plants just have opened back up, and we're on the list to get stuff in here to get repaired, because I have quite a few. And we're gonna tear up some more tomorrow, so we will be working on Bay Street there by Branch Street tomorrow due to a collapsed sewer. So I called them and the guy said, we're on the list, but where we have little stuff, some of the larger people take precedence over us.
Bay Street, is that at 301?
No, 101 Branch, actually the construction we're gonna be at is 101 Branch Street, which is at the corner of Branch and Bay, but the sewer runs out of the house from Branch Street to Bay Street.
Well, there's a spot at 301.
Yep, and that's on the list too. I have about 24 different locations where we've had leaks and had to tear up roads this year that need to be fixed. And just to bring you up to speed, I'm sure everybody's heard and complained about Bay Street because I get them 50 times a day. But as you can see, State Highway is going across 113. They've got 3 pipes are laying. They have to shut down. They're shutting down the right-hand turn lane on the northbound and the slow lane. The reason being they have to leave it shut down is because they have to flow. They're pouring cement in between each of the concrete pipes. That's called flowable fill. So it gets in there instead of stone and dirt, because sometimes stone and dirt doesn't get all the way down in there, where concrete is more of a liquid sand. It's got a heavy concentration of sand. It'll get in there better. So tomorrow they should backfill that, and then they will be doing the fast lane, the turn lane, on their northbound lane, and then they should be able to get into the fast lane of the southbound at one crack. So probably 2 more weeks of them going across 113, they should be done. And I was advised they should start back blacktopping as soon as they get across. They're going to get a base coat across down Bay Street.
That's a massive cut.
That hole is huge.
It's about 14 foot wide. I mean, the excavator can't. Most trenches, when you put sewer pipes in, the excavator can straddle it. They can actually walk the excavator down into it, so that's how it's and the excavators are about 12 foot, and it's wider than the track, so it's about a 14-foot wide cut across there.
But if you take a look, you can start to see where that widening is starting to take shape.
And I do believe it was a splendid idea to have it blocked with that piece of equipment.
Yes, and we receive, I probably get, I exaggerate 50 calls, but I probably do get anywhere between 15 and 20 calls a day. All I can do is just advise you, I mean, it's a state highway, I do call them and say, hey, look, people are complaining, they're like, they're hoping to have some of the trenches repaired and some of the roughness taken out within the next week. That's what I spoke with Bramble Construction, so that's all. I mean, I keep telling them, but they're working as fast as they can to get across 113 so they can start getting the road fixed.
Thank you.
Hey, I have a question.
Mm-hmm.
This is probably, well, I don't know, it's one of you. Jimmy Charles or maybe Jamie. One of you, at least Jamie, I think you said a few minutes ago when we talked earlier about the process of doing the work, and then you have to hire flaggers and those kinds of things. So that's outsourcing, right?
We pull from, if it's our town project, we try to stay internal.
That's what I was wondering.
But we have to make sure we're certified, so Tim usually sets us up. Everybody I have in the water and wastewater department certified. Tim's guys help us. I mean, I'm gonna tell you like this. We work for the town of Berlin, so if Tim needs help, we help him. If we need help, Jimmy or Tim helps us, so.
Well, that's where I was going with the question. As far as the flagger certification, my question was, they have to be Tim's people?
Tim's capable of
Oh, you do the training?
You wanna get certified?
Yes.
Yeah.
I didn't, but,
The way it's actually done, now, I'm actually certified to teach flagman training in Virginia, Maryland, and Delaware, all three.
So would it be beneficial to have, like, Public Works certified as well?
They are.
Well, I didn't know that, that's why I'm asking the question. That's why I'm asking, I didn't know, yes.
The way it's done, we used to do it right here in the house, the training, but since COVID occurred, it's now all done online. So all I do is set up each employee online, and then they receive a link to the training, and then they just take the test online.
Yeah, my head was thinking about not outsourcing, that's why I asked that question.
Thank you.
But that should be.
Anything else for Jimmy Charles?
No.
All right, up next is our Deputy Town Administrator, Mary Bold.
I really don't have anything except to echo what Ivy said about Take Pride in Berlin and Cleanup Day. And that is about it. Thank you.
Board of Election Supervisors. We can't say it enough.
Yeah.
But yes.
That's.
Is that one position?
It's 4. It's 5 total.
One gentleman retired and
Right.
resigned, and the others are up for terms. So it's just some of it is just part of the process. But.
All right, up next, any questions for our Deputy Town Administrator? All right, up next, comments from the council. Councilmember Nichols, would you like to go first?
Sure, I'll go first. Folks out there in Berlin, please, please, please apply for these boards and commissions. I can't say it enough. We need you. The town needs you. I guess that means us. But yeah, your services are needed, most definitely. I learned something new in this facility every single time that we're here, and I guess for the next 2 months we'll be here every Monday in some capacity. So I guess we'll learn something all the time. But learning something new here, not just for myself, but for those folks out there, I think is beneficial. And really and truly, when I ask you guys questions, it's not just for my benefit. It's because a lot of these people out there are wondering the same things, but they're not here to ask them. So thank you for always being willing and able to answer those questions.
Thank you. Vice President Burrow.
I don't have a thing.
Councilmember Grant.
Nothing tonight.
Councilmember Orris.
Yeah, just real quick, Chief, are the tours back on for the police department building?
Just started back, and we just started letting our partners use the actual training room.
Okay.
So again, we're at the end road finally, and we can go move forward with those things.
Okay. Well, I just want to say I think it's awesome that we're at a point where the police station facility is is almost nearing completion of being paid off, and we have an opportunity to discuss and see options for that casino money that's coming in. And if you, I guess, contact Chief if you're looking for a tour of the building. It's awesome. I've been in there, but that's really all that I have to say.
Thank you. I have agenda item number 14, comments from the mayor. I've spoken enough. Agenda item number 15, comments from the public. Ms. Hanbury, anything you'd like to say? You're the only one that's still here with us.
Do you don't mind? I'm sure you've
No,
been
you're
up
more
like
than
I have.
welcome. You've waited.
May I sit right here?
Just speak loudly if you don't
Okay,
mind.
I always speak loudly.
Name
So,
and property address for the
Yeah,
record.
Sarah Hanbury, 100 Washington Street. So I wasn't coming to speak today. I was coming because of my AGH people, and I hope that we do support them as a town. They, are bringing in new doctors all the time, and I say, look, I can't even get kids to sell beer. I don't know where you find a doctor. They're not on Indeed. So they are bringing new families into our community and constantly making our community better. So my notes here says that we started with the young kids, talked about the sanitation, the hospital, crematorium, so that's the full circle of life right there. I'm personally, as a resident, I'm totally fine with a crematorium. People happily live next to cemeteries. I mean, Mr. Burbidge is probably gonna build something somewhat tiny and tasteful to get the job done. I mean, it's part of our lives. Okay, what else did I want to say? I think there could be a Washington Street sinking. I think there could be a sinkhole. I'm not parking my car on certain parts, so when y'all are done doing everything else you need to do, parts of Washington Street, the asphalt has dropped about 4 to 6 inches.
Can you be more specific in the
Sure, next to the sidewalk, one house over.
Okay, so we're working.
So not 102.
We're working west.
Correct,
Okay.
towards Maine. Just saying, looks a little sketchy. My husband and I are like, we're not parking our cars there.
We'll evaluate that tomorrow morning. Thank you. Don't wait on stuff like that. Anybody that's watching at home, if you think there could be a problem, bring that to our attention.
Yeah. For the chief, if you're able to name the officer that boldly jumped into a burning car, is that something you're able to share with us?
Jump into a burning car.
Didn't he?
But, well,
Yes, well, he pulled a person from a burning car.
and the fire department, what he did is made sure that they didn't catch on fire and
Okay.
did some different things. What we're doing is evaluating that, but it was, PFC Lloyd.
Okay, thank you. Again, in your wheelhouse here, I have a burgeoning 14-year-old boy who's lovely. But for his birthday, he asked for an aerosol BB gun that looks exactly like a handgun. And he says, well, Mom, you guys had guns growing up. I said, I didn't live in a town, and it doesn't look like a handgun, and it's not 1970 anymore. So that was a big no. But he's like, it's just a BB gun.
You just said the chief said that
Right.
you're not allowed to go ahead and shoot BB guns within town limits.
Okay, well, I'm just saying, if this is a trend that's made it into my domicile, it might be a trend that's circulating throughout the middle school age children.
Yeah, it is.
Aerosol BB guns?
Oh, yeah.
When
I
they
don't,
do
they,
they're not
look
even
scary.
just, not to keep us here all night, but they're not even just BB guns. They look like assault rifles and everything else.
Oh, they look awful. I mean, and as an owner of a liquor store, if I saw somebody and they're like, oh, it's just a BB gun, I'd be like, what? Like, no. And that's what I said to my 14-year-old. I said, look, where are you going to take this? You live in a town.
Well,
you
there are
can't even take it
places-
outside.
There are
Somebody's gonna see
places,
it.
there are places where you can take them for recreational play.
Sure.
And I can tell you those names because my children do own them, but we have had those conversations.
Right.
They stay in their cases until ...
Sure, and I was raised the same way, but I was like, you're not pointing at Justine's house or the Stack's house or the Farr's house or the, so anyway, that's not happening, at my house. He's getting a sleeping bag instead. Does anybody know if I was told that during Prohibition, there was a really long basement under what I call Main Street and Antique, that does that basement exist? And if it does, can it totally be like a tourist distraction for Berlin?
I can tell you that when we did the sidewalk work at the corner of Main and Pitt, that they fell through a basement.
I was told
So-
from the old timers that that was one of the speakeasies
I mean, I
where
see
they
those.
would hold the hooch. Yeah. Yeah. So, I mean, every time we're like, man, if that basement's still there, like,
Well, having been to a couple of towns that have those tunnels,
yeah.
and they talk about them on their ghost tours and whatever else, they don't let you go down them. They might, I don't know if Berlin is, if we're that kind of town, but every town that I've heard of that has them, that I visited, they talk about them, they will point out where they are, but you are not allowed to go in them.
Okay, well, this was told to me by Doc Abbott, who owns the Abbott Farm out there across from Cheers. So because his father actually owned the Lucky Lindy, which was the speakeasy in Ocean City. So I'm just saying, it's just another cool Berlin.
You can talk it up and like I said, point to where.
No, I want to go down there. I don't need to drink there. I can go to the lodge or the hotel. But, Mayor.
Yes.
Zach. I applied last spring to serve on the Arts and Entertainment Committee. It's been almost a year. I gave you a resume, I applied online, and we haven't gotten anywhere, and it's almost a year.
And you had one of the stellar applications.
Well, I do things well, and I've never worked
You did an
so hard to
excellent job.
volunteer before. Usually people want my services. Anyway, I've worked with OCDC, which is Downtown Revitalization, for 25 years in Ocean City. So I kind of know how to do that whole like old town sort of graphic design thing. And then I worked for the Chamber of Commerce as their graphic designer. I did graphic design for the hospital. I've done graphic design for the town. And, I put on a pretty good Halloween party too. So, and I have a degree that says I went to art school, so I'd really like to volunteer for arts and entertainment. And it says, you wrote to me in November that the council needs to approve the creation of an arts and entertainment committee. So I think they'd be in agreement.
They've already approved it. They
Oh,
already
okay,
approved
so
it.
moving on. Okay, well, I hope that you
So-
agree that I'd be good for arts and entertainment.
You were actually on the,
I'm on the
slate.
to-do list.
No, you were scheduled.
Oh, I am? Okay.
You were scheduled, however,
Okay.
we ran into a loss of a department head, not a loss of a department head.
Oh, I thought you
through our
like
schedule.
found something in my
No,
resume that didn't
no, you didn't
allow me
miss
to
anything.
volunteer.
So you were scheduled, you just didn't know about it,
Oh.
and, which is very helpful. And then the other side is that we do appreciate you wanting to volunteer. I know you have volunteered at the visitor center as well and helped out on many events, and we appreciate that.
Yeah.
But I also want you to know that, just like those that applied for, the Berlin beautification, we haven't forgotten about you.
Right.
But we did have to fill some other positions before we got to, the way that it's structured, you have boards and commissions that are defined that have to
No, I know.
meet a certain threshold, so.
Yeah, you created a busy structure with it.
It is, it's a lot, I mean, you
could have just
figure,
said, hey, Sarah, could you do this? And I would have said, yeah.
and we would, it's not anything against anybody's talents
No,
or
no.
what they could bring to the table, but I think that we have built out a rather laborious process.
You did.
But it also has opened it up to make it a little bit more equitable for everybody. So I appreciate your application.
Okay, that's everything. And Frisbee golf was a lot of fun. We did that the other day.
Thank you. And thanks for staying for the duration of our marathon.
Well, thank you all of you.
Thank you, Sarah.
Any comments from the press that are?
No.
And then, Vice President Burrell, all in favor?
Aye.
Thank you.
Actually, you get this turned off.
No, I gotta go with my presents.